Buenas and half a day. The Committee on Health and Veterans Affairs is now called to order. The time is 2 o'clock, and today is Wednesday, February 19th. Thank you to everyone joining us both in person and online for this public hearing on Bills 13 and 31. Bill 13, introduced by Senator Therese Terlaje, seeks to establish a public-private partnership for Guam's Public Hospital, aiming to enhance healthcare services through collaborative efforts between the government and private sector. Bill 31, introduced by Senator Parkinson, proposes amendments to Guam law regarding administrative rules and regulations to expand options for assisted living facilities, ensuring greater accessibility and improved care for our elderly community. Notice of this hearing was provided to senators, stakeholders, and the local media on February 12th, 2025 and February 17th, 2025, thus meeting the requirements of the open government law. In addition, notice of this hearing was also posted on the Guam Legislature's website and the Guam Public Notice Portal. Materials for this hearing were shared in the committee drive and are available for print upon request. Recording of today's hearing will also be available online via Guam Legislature Media on YouTube. I would like to acknowledge and recognize the committee members that are present here today. Vice Chair and Vice Speaker Senator Tony Atta, Senator Sean Gumatau, Senator Vince Borja, and Senator Shelley Calvo. I'd also like to recognize other lawmakers that are with us today, Senator Therese Terlaje, Senator Chris Barnett, and Senator Tello Taitagui. At this time, I'd like to invite all invitees and participants in today's public hearing for Bill 13, again, a bill to establish a public-private partnership to manage GMH, to come forward. This one is on Bill 13 for the public-private partnership. 13, the PPP bill introduced by Senator Therese Terlaje. Starting on my right, if you could please state your name and whether you represent any government agency or organization.
Mr. Raymond Salas, I'm from Jigo. I'm a private citizen.
Thank you.
Lillian Perez Posadas, Guam Memorial Hospital, Hospital Administrator. Thank you.
Good morning, buenas and half a day. Varadi, I'm a neurosurgery chief medical officer for GMH. Happy to be here.
Again, the two bills before us today, if enacted into law, will have a significant impact on our community. I sincerely appreciate the presence of my colleagues, stakeholders, and members of the public who have taken the time to engage in the legislative process. The purpose, again, of today's hearing is to gather input, discuss the potential implications of these measures, and enhance transparency and accountability in our decision-making. As we proceed, I want to remind everyone that each senator will have 5 minutes to speak. The author of each bill, however, will be afforded 10 minutes to provide a summary of their legislation. These time limits allow for a structured and efficient discussion while ensuring that all voices are heard. I encourage all speakers to be concise and mindful of time so we can accommodate as many perspectives as possible. Public engagement is the foundation of good governance, and your insights are invaluable in shaping policies that best serve our island. At this time, we will begin with remarks from the author of Bill 13, Senator Therese Terlaje.
Madam Chair. So this bill proposes to establish a public-private partnership for Guam's Public Hospital, or Guam Memorial Hospital. It was introduced in response to the dire condition that we all agree is occurring at the Guam Memorial Hospital, despite the very great efforts of its professionals that are employed there and the management team. This bill proposes that a committee will be established, and it lists the members of the committee who are stakeholders, and that they will be tasked with developing an RFP for a public-private partnership. And then it will mandate that RFP that the committee comes up with will come down to the legislature. The legislature will Committee on Health Chair will also have a public hearing on it, get any other public input, and the legislature must then decide what amounts it is able to appropriate to before that RFP can be solicited. So when the legislature does that, then it will send any suggestions back to the committee, but it would be then an appropriation that would have to be made in a separate legislation so that that RFP can then be eventualized, right? Where GMH will send it out, or Geda, and get solicitations back, proposals back. So the goal of the partnership that the RFP should solicit is to make the hospital operate more efficiently, enhance patient care by improving services, including but not limited to enhancing billings, collections to maximize revenue, updating the Medicare or the TEFRA rebasing, streamlining the daily operations to improve efficiency and reduce costs. The idea is not new. It was proposed in probably prior to that, but I only went back as far as 2016. The Guam Memorial Hospital Task Force analyzed various options and recommended, excuse me, that a public-private partnership would be the viable long-term solution. So I had asked the chairperson to please invite all the members of that previous task force. There were very many of them. And later that same year, Geda did publish a request for interest to solicit public interest relative to the management and operations of GMH. And they did receive 3 responses, and they summarized the responses and made recommendations. In 2020, another bill was introduced which sought to initiate a public-private partnership process. This bill was objected to by GMH. GMH generally said, there were issues with the procurement process, and they thought that they could do this themselves, and that we should put our faith in them to continue and allow them to bring GMH up to the standards that we need. In 2024, so that bill did not move forward. In 2024, the governor in her State of the Island address stated, quote, "With regard to GMH's current management and operational challenges, we are in active discussions with off-island experts to assess operations, including the financial system and revenue cycle." As we know, GMH's financial situation has been reaffirmed to us most recently in October 7, 2024, and even I think earlier in the oversight hearing that was held in this term, that the vendors were still in need of payment, despite the legislature having, back in 2023, given a budget higher than what the governor or GMH had requested, given an additional $30 million of general fund money to pay for vendors, and supposedly promised $20 million for capital improvement projects. So in October 2024, we learned again that the financial situation was still dire. But they had reported at that time that they were obligating all the ARP funds for capital improvement projects. We learned, of course, in January, that the money for the ARP projects did not materialize for GMH. It was taken away, so they did not have that money. And that was, I discovered that after the bill was introduced. The bill was really just meant to make a stable funding for GMH. We would have to promise by contract what we are going to fund, and they would be able to work with that, and there would be no meddling of taking money out or not allowing the money to get there because there's a private partnership involved, and we would have to meet our commitments in that contract, as well as they would have to meet their commitments and what we expected them to do in our negotiation and in our contract. So all of this is to ensure some stabilization and continuity and prevent recurrence of some of the existing issues when we move into a new hospital. This bill allows that this contract will extend to any new hospital that will be eventually built, and that way these problems hopefully will not carry over, and that it will be properly planned. And the whole goal of the bill is that we are going to have a plan, and we are going to follow that plan, and there is no single person on Guam who can take away and make GMH depart from that plan, that we are all going to be working on the same plan, and it's going to be a very public plan that we have all agreed to. So I want to thank the committee for scheduling this hearing and those who've come to testify. And if I could just read, there was a, sorry, the list. Can I read your list of who was invited? Yeah. So we get to ask the chair of the committee to invite, and she has invited those members of the task force, including, oh, they're not listed here, sorry. Let me just get it. There. Yeah.
At the request of Senator Terlaje, invited were the representatives from the Office of the Governor, Geda, GMH, the GMH Board of Trustees, the Hospital Fiscal Review Committee, the Department of Administration Director, BBMR Director, members of the 2016 GMH Task Force, the Guam Medical Association, Guam Medical Society, Guam Board of Medical Examiners, the Guam Nurses Association, the Guam Board of Nurse Examiners, the Director of Public Health, the Guam Chamber of Commerce, and the Women's Chamber of Commerce.
Thank you. Thank you very much, Madam Chair. Some of those hospital task force members in 2016, which spent a lot of time reviewing options and coming up with recommendations, including our current governor, Lulian Guerrero, former Senator Dennis Rodriguez was leading that task force, Mr. David John, Mr. Chris Felix, Mrs. Jenny Cruz, Mr. John Rios, Mr. Rich Huang, Mr. Rene Ramos, Mr. Tony Scrow, Attorney Rodney Jacob, Dr. Florencio Lizama, Mr. Joey Calvo, Mr. Lester Carlson, Mrs. Tina Garcia, Mrs. Benita Mangalonia. Situs Masi, and I look forward to this discussion. Thank you, Madam Chair.
Thank you, Senator Terlaje. We will now proceed with public testimony on Bill 13. Again, as you provide your comments, please speak clearly into the microphone, state your name, and indicate whether you are testifying on behalf of a government agency in your personal capacity or for an organization in the community. We will start to my right, Mr. Salas.
Thank you, Senator. Good afternoon, Senators, Honorable Senators. First, I want to just echo what the good Senator Terlaje had mentioned of the folks from GMH. They are some real hard workers over there, devoted, dedicated, and committed to ensuring the health of every citizen on Guam. So I admire that part. I spent over 21 years with public health, and I've worked with GMH, a lot of their employees personally. So I know a lot of them are really hard workers, hard chargers, and very committed. First off, I just wanted to, as I was looking to the bill, you know, for so long, we've had meetings, public hearings, inviting the GMH to state their position and the dire need of the repairs at GMH. I think it's about time that we really focus on this private partnership. I don't know if we want to continue providing $20 million shortfalls every year. We want to hear that every year. I think that needs to stop and visit this private partnership. I think that's the direction that we need to do as a community. As I read through the bill here, I noticed that the National Institute of Health reported that with private-public partnership, that the hospital performance indicators include service quality indicators, further hospital with private partnership were considered able to reduce corruption with the existing anti-corruption mechanism through discretionary control. So I think with that organization at the federal level, I think that pretty much provides you an indicator that this is probably a forward motion that we, especially this body, should consider moving forward with this private partnership. The other thing that I noted also is the formulation of the committees. I understand that the original committees that came up with the original plan did not involve any medical folks like our doctors when that plan was formulated and, I guess, published. So that was something that I was interested in looking at. And if I might just ask of this new hospital, I understand that a helipad is also asked to be provided for the hospital, with the hospital. Is that true?
That was in the plan developed by Matrix, yes,
Yeah,
a
the helicopter
helipad.
pad. Okay, with that, my concern in this committee is if you do have a helipad there, an operation, I believe that not only the medical doctors, you need perhaps the airport authority and FAA to be involved. Because now, if you're involving yourself with air operation, that's a very expensive venture in and of itself. When you have that type of operation, you need to purchase a helicopter. You need maintainers for that helicopter. You need a marshaller for that helicopter. Safety in that aerodrome. You need FAA to establish in-flight route. We don't want to be able to have a helicopter operation there, and then all of a sudden, I don't know if you remember the Washington, D.C. crash with the helicopter. That's one of the things that we really need to take a look at as a safety factor. We don't want a repeat of a Washington, D.C. where a helicopter and an airplane happened to collide. So, in that in mind, I hope that the Geda Guru would include the airport authority in that task force or the committee, and because that individual will probably be engaged with the FAA because of that new operation. But I'm here to say I support this measure, and I hope that what I said today would reflect on the importance of not just safety, but in recognizing this ongoing situation with GMH. Again, I want to say thank you to the GMH staff. I think they're great people. And with my 21 years with government of Guam, I was able to work with a lot of them face-to-face, firsthand. Thank you so much.
Thank you, Mr. Salas. Lillian?
Thank you. Buenas. Senator Sabrina Salas Matanane, Chairwoman of the Committee on Health and Veterans Affairs. Senator Tony Ada, Vice Chairman of the Committee on Health and Veterans Affairs, and all senators who are present at this public hearing. As the Guam Memorial Hospital Administrator, submitted herewith is our perspective and testimony in response to Senator Terlaje's proposed legislation, wherein Bill number 13-38 states on page 4 that it is the intent of the legislature in Guam to solicit assistance for the management of the Guam Memorial Hospital Authority by mandating that an RFP be developed and published by the GMHA P3 Committee for the purposes of creating a public-private partnership for the Guam Memorial Hospital. We are not against a public-private partnership model. However, we do not support the proposal and process proffered in this bill as it is written. Firstly, per the Organic Act of GUAM'S, Section 29, subsection 48 of the USC, the governor shall establish, maintain, and operate public health services in Guam, including hospitals, dispensaries, and quarantine sections. This bill, as it is written, states that it is the intent of the legislature, Guam, to solicit assistance for the management of the Guam Memorial Hospital, contradicts and is not in accordance with the Organic Act of Guam that inaugurates the authority and the power of the governor. Secondly, the basic, fundamental, and inherent challenge of Guam's public hospital is its financial inadequacy and underfunding. As you mentioned, Senator Terlaje, we've had to come down here several times. It is a government public hospital with the mandate to provide healthcare services and medical treatment to all individuals, regardless of the individual's ability to pay. The legislative branch has the authority and the duty to appropriate the adequate funds for the hospital. Procuring a private partnership corporation will undoubtedly cost more money and funding that is not appropriated or identified in this bill. And I know, Senator, you mentioned that later on there will be another legislation to then get the appropriation. In order for an RFP to be published, funding must be appropriated to certify the RFP. If no funding is appropriated, GMHA cannot and does not have the financial means to certify the proposed procurement. GMHA has historically been in a deficit footing since the local government took over from the U.S. government the role and responsibility of providing hospital services to the people of Guam. Prior to 1956, healthcare, free healthcare, and hospital services were provided. After 1956, the original Guam Memorial Hospital was constructed at the Sutpun Point, and therefore, free healthcare and hospital services continued. In the 1970s, because of this free healthcare and hospital services, the hospital's deficit was $9 million. In 2015, the deficit increased to $15 million, and in 2019, the deficit grew to $30 million. The bill's findings and intent also acknowledges the underfunding of the hospital on page 2, lines 12 to 16. The Guam Memorial Hospital also submitted their 2025 fiscal year budget request to Legislature in Guam, requesting $75.3 million for fiscal year 25, but received only $37.7 million. GMHA officials testified in an oversight hearing on October 7, 2024, that without an additional $20 million, the hospital's operations are at risk. And so thank you for that, for appropriating that additional amount of money. Recently, in a preliminary meeting with our CMS Medicare cost report consultant, a review of our fiscal year 2024 cost of services solely for the Medicare beneficiaries was $31 million. However, our eligible Medicare reimbursement is only $14 to $16 million. This is an enormous gap that compounds our financial viability. It is also important to note that the last paragraph on page 2, line 23 statement regarding Medicaid rebasing, that statement is incorrect. There is no Medicaid rebasing, it's only Medicare. If I may also point out on page 7, lines 6 to 8, it states that the Committee on Health shall conduct at least 2 public hearings on the RFP and transmit appropriate recommendations on the RFP to the P3 Committee for consideration. This statement will violate the Guam procurement regulations and statutes. That's all I have to comment on, Senators. And so I thank you for considering my comments on Bill number 13-38, explaining our views on position in opposing this legislation. Thank you.
Doctor.
Buenos and half a day, Madam Speaker, Vice Speaker, Senators of 30th legislature. It is with profound humility that I address the legislature today on Bill 1338. Being a medical administrator at the hospital and also a neurosurgeon, I've had a chance to be intimately in tune with some of the needs of the hospital, not just with costs, but also with providing care. And I give this testimony based on my background as a physician and also as a healthcare policy of interest. The partnership between the public sector and private sector for delivering a project or a service is usually what a PPP is. And that project can be usually infrastructure, sewage, roads, a hospital. But for a PPP to manage healthcare, that is a new venture that has not been explored quite yet, but it is possible. Some of the intricacies include that some of these PPs allow for large-scale government projects, such as bridges and hospital infrastructure, not management, but building the hospital. These partnerships work well when the private sector uses their know-how technology along with innovation with the public sector to actually intertwine to complete work on time and on a budget. Typically, it involves private capital funding and financing upfront, and then there's taxpayer money that's paid for it in the back end, or the users of the services pay for this. So this is not without cost. This will cost, and it will cost a lot of money. Usually, public-private partnerships are used, again, for infrastructure projects. For example, maintaining schools, hospitals, transport systems, and sewer systems. Hospital maintenance and hospital management is very complex. It's not just the infrastructure and the building, it's also the services, from radiology to internal medicine to ICU services. It's a very complex network of systems that come together to provide care for patients in a hospital. So when we talk about a public-private partnership, we have to define exactly what we mean and what we want. Is it that we want the partnership to run the medical services, run the dietary services, run the maintenance services? I think that needs to be fleshed out before we even begin to think about these partnerships. Arguments against PPPs. These typically are longer, more costly in comparison with traditional public procurement systems. There is added costs for transaction fees. There's loans that need to be had. There's also complicated and flexible clauses that need to be considered in the sense that you can't envisage or envision future problems that come with these things. And because of their inflexibility, it makes it difficult to augment your plans. And so these become very, very costly in the future. PPPs usually also are finance projects because the private sector has higher costs. And so in the long run, it's going to cost the people of Guam a lot more money to implement this compared to the current system of public procurement. And I think these high interest costs need to be taken into account before we go through this process. These things are also controversial in the sense that the return on investment has not been the best based on research. Now, arguments for include this ensures that there is necessary investments into the public sector and effective use of public resource management. Again, this is for infrastructure, not hospital management. Hospital management is a very complex system that you can't ascribe to a private partner because it requires day-to-day operations of procuring supplies, dealing with contracts with doctors, dealing with doctors getting sick and having to replace some of these doctors. These are not things that can be run by a private company, only because the local infrastructure is not well known by these private companies, and so they be coming in almost blind and rely on research that hasn't been done to basically implement some of these management structures. In the long run, it will cost us more money. These investments also impose a lot of extra expenditure on the taxpayers because costs are not fixed. Costs are very fluid in the sense that today the cost of a brick is not the same cost as it is next month or in 2 months. And so as the costs go up, so do the taxpayers' expenses. The different types of PPPs include where the private company builds, they operate, and they transfer the service or structure to the public sector. Another option is to build the structure, they own and they operate it. Another option is to design and then they build and they finance it. But within this bill, there's been no delineation of exactly what the plan would be for how to transition going forward. And I think that needs to be flushed out before we even look into this PPP system. So governments in the past, especially cash-strapped governments, have looked to PPPs to solve problems in healthcare delivery. This has been mainly for, again, infrastructure. In Canada, in the UK, Australia, this has been done very well. Only India is the only country that I know of that has actually tried to use PPPs to actually manage healthcare. That data is not out there to see how it's been done and whether or not successful. And so I caution the people of Guam to not go down this path unless research has been done to make sure that there will be a successful investment of the monies, in my opinion. In theory, this system works well when you're dealing with, again, infrastructure. But when you have to manage a hospital, because of the complexities, it makes it difficult to control some of these arrangements in these contracts. If you look at the makeup of the payers on Guam, you have about 50% of patients that are under Medicare, Medicaid, and MIP. We all know that Medicare, Medicaid, and MIP have low reimbursement rates because of the fact that we're under a TEFRA system. That makes it difficult to be able to collect enough money to run the operations of a hospital, which is the reason why GMH has come before the legislature multiple times to request funding because healthcare costs are going up. If you go to Payless, the eggs now cost $10. When I first came to Guam in 2018, eggs cost $3. It's not just the healthcare costs, the cost of living on Guam is going up. If you look at the payer mix for the hospital, 20% are self-pay. I'm sorry, 22% is self-pay. If they're self-pay and eggs cost $10, how will they pay for care for their health services? They're not going to, because eggs are more important. If you look at the insurance makeup, only 20% of Guam people actually have insurance. With that 20%, there's no way your hospital will make money. This is not possible. So this payer mix is not favorable for a public-private partnership because they will not make any profits. And the goal of private companies is to make profit. So there's no way that they would be interested in doing this unless there's a cash infusion from the people of Guam. And if that's what's going to happen, that cash infusion should go to GMH to shore our needed services for the most part. I believe that one of the concerns for why this partnership is being addressed is that there is the concern for reduced costs. What I see is actually increased costs. And so I do not believe that this would be a good way to go unless we define exactly what we're looking for from these public-private partnerships. Once we have a better understanding of exactly what the goals are, I think we can then move forward. Again, this with the most humble approach I come to you with my testimony. Thank you very much.
Thank you, Dr. Quasi. Melanie?
Hafide, good afternoon, everyone. My name is Mel Mendiola, and I'm the Administrator CEO of the Guam Economic Development Authority. My testimony, I decided to incorporate something new, so I'll forward this to you, Madam Chair, so that you have it after the testimony. I thank you for the time today. A couple weeks ago when we were here, I was up that night and I couldn't sleep, and I started doing some research because I couldn't believe that. I said, there's public hospitals all across America that are closing, and I don't think we're the only ones. And so I'd like to look for, just like the good doctor here, look for research and see what's really the problem, and where is the problem. And so I found an article in the Center for Healthcare Quality and Payment Reform, dated January 2025, and the title of the article is Rural Hospitals at Risk of Closing. And ultimately, what it talks about is over the past 2 decades, nearly 200 rural hospitals have closed. In addition, 35 hospitals have eliminated inpatient services since the beginning of 2023 to qualify for federal grants that are only available for rural emergency hospitals. More than 700 rural hospitals, 1/3 of all rural hospitals in the country, so there's about 2,000 hospitals, 700 of them are at risk of closing because of serious financial problems, and over 300 of these hospitals are at immediate risk of closing because of the severity of their financial problems. Now, I thought to myself, there can't possibly be 700 poor management teams across America. There's a lot of good people working in all of these organizations just trying to do what they can, just like these good people are doing. Where's the problem here? And the common theme that occurred among these hospitals is losses on patient services. Almost half of the rural hospitals lose money delivering patient services. It costs more to deliver healthcare in a small rural community than in an urban area, and many health insurance plans do not pay enough to cover these costs. And I think if you talk, I spent a little bit of time with Ms. Lil and with her finance team, and they'll share stories of how a patient on Medicaid, this is the negotiated day rate, and if it's $10,000 to deliver their services today, the max they can claim is $1,000, so that leaves them in a $9,000 hole for every single day that they're there. That's where we are. Insufficient revenues from other sources to offset losses. Many hospitals have managed to remain open despite losses on patient revenues because they receive local tax revenues or government grants. However, there's no guarantee that these funds will continue to be available into the future or that they'll be sufficient to cover higher costs. Public hospitals, and the primary reason for hundreds of rural hospitals at risk is that the private insurance plans are paying them less than what it costs to deliver services to patients. So in none of these, throughout this article, it never cites that, the management team is too heavy on accountants, or maybe we have a mismatch in our management structure. So one of the things that has been contemplated in all of these was just better communication with their local governments about what it costs to run a public hospital. So if I were running the hospital, for example, I would not come to you and say, we need $30 million in it where it's an emergency state. I'd come to you at the beginning of the fiscal year, I'd say, we're gonna need $40 million. That's just how it's gonna be. And then at the end of the fiscal year, I'd say, we only spent 36. You're welcome. Meaning, I think we all as the people of Guam need to understand from everything, and I mean, and you can do the research yourself, but from everything that I've read, public hospitals aren't meant to pay for themselves, unfortunately. They're just not. That's not how insurance is set up, and it's not how the federal programs, Medicaid, Medicare, Medigap, all those things, they don't give you a premium on the service you're providing. And so if we're always playing catch up, and with the Trump administration, he's pushing a lot of the responsibility towards the states. So the trend is moving upwards that the state is gonna have to absorb more of this responsibility going forward. It's not a matter of, oh, how much are we gonna have to bail out of the hospital? It's how much are we going to dedicate to the hospital this coming fiscal year? And if the management team comes back to us and delivers, they defend a number, they say, we believe we'll be in the hole $30 million, so that's how much we want. And then if they come back at the end of the fiscal year and you said, Hoffa, you came to us in the middle of the fiscal year and you said you needed 30, but now you need an extra 10. What were you doing, Ms. Lil? You know, and then you do those sorts of things, right? But then if you come back at the end of the fiscal year and Ms. Lil says, I actually only spent 25, then what do? We give her a raise. Or, I mean, you know, you know what I'm saying. I'm being facetious, but we get, but if we all change our mindset, right, along those lines, that to me is a lot more productive of an approach towards dealing with hospitals rather than trying to change the structures of things around people. You know, in any event, I'll send this article for all of you to review. Relative to this specific legislation, we like the intent of the legislation. Geda likes we're all about PPPs, okay? PPPs are the way of the future. Hospital, right now you have at Guam Power Authority, much of the power generation occurs with PPPs, but the transportation and distribution occurs with the Guam Power Authority. At the Guam Airport Authority, just like the doctor mentioned, PPPs are very effectively used to build infrastructure. Our schools, the ones that were all built, you know, the last 6 schools, I want to say, all PPPs, right? In fact, in the last legislation concerning the hospital, Public Law 37-9, or no, I'm sorry, Public Law 26-56, stakeholder management, but I'm sorry, the public law that authorized the $35 million per year for the payment of the hospital, it contemplates it within the framework of a PPP, meaning it's a lease back, right? So there's a PPP already embedded in that legislation, right? So we don't have anything against PPPs. They tend to be a good way forward. A PPP specific to operations, as the doctor said, maybe we need a little more research with that. Just for the education of the newer individuals serving in the legislature, if you visit guammedicalcampus.com/task orders, you'll see studies that go back to 2010, well before this administration. A common trend among these initiatives has been we do a study and then nothing ever advances beyond that study. Usually it's because of fiscal constraints. And now we're in a position where the fiscal constraints are a little less constrained, right? We have a little more breathing room with the 5 years or so of surpluses under the Leon Tenorio administration. We have the opportunity to move forward. And when the 36th Guam legislature acknowledged this by passing legislation to allow for the financing of the new hospital under the traditional leaseback model, it was a construction focused on a public-private partnership, leveraging both the bond market as well as potentially the federal market of the federal agencies, such as USDA, which allows for 40 years for your repayment to occur over 40 years. This public law outlines stakeholder involvement, including Geda, DPW, Land Management, BBMR, Department of Administration, GMH, Public Health, Guam Behavioral. So these were the number of agencies involved, contemplated in this law. There's also been public involvement in planning stages of the medical campus. If you go back to the medical campus website /meetings, there's about 10 or so meetings that take place, and even attended by members of the committee. But through it all, one consistent piece of feedback during the committee meetings, as well as all the villages when we visited to talk about, I think it was Edda Gagat, and also Speaker Frank Bloss Jr. also made his concern apparent about needing to fix the hospital operations, right? So it kind of goes back to that quite a bit. We always talk about hospital operations. So in an effort to do that, Geda issued RFP 24-006. This wasn't the medical action plan. This was not funded by old CC. We wanted to target ARP funding, but then during the procurement and all of the negotiation, ARP deadlines came and went, and then we had to kind of figure it all out, right? So the ARP deadline went, and we said, okay, we have this study that we want to do, or we want to continue doing the work on this to look at and analyze the operational structure of GMH. So what are we going to do now? So the RFP does the following. It contemplates the following. It wants an analysis of the healthcare needs of the population, including the subgroups and region, and a projection of future healthcare needs, a description of the organizational, programmatic, and fiscal challenges being experienced by rural, small, community public hospitals across the states, an analysis of regulatory and accreditation mandates, an analysis of current hospital revenue streams, potential untapped revenue streams, a description of challenges and or continuing need for government funding support. So this is how I think we can come up with that. What is the magic number that the government needs to think about every year? And a recommended organizational structure that could further ensure the likelihood of a successful, sustainable hospital. So are we too top-heavy? Do we have too many, I don't know, cafeteria workers, whatever it might be? Our RFP asks the experts to analyze our current hospital situation and recommend strategies. Not a one-size-fits. It doesn't ask really to focus on a one-size-fits-all, but because this is of interest, of course, this will be something that will be that we will request them to look into. And the bill suggests the formation of a P3 committee to create the RFP, but I think we already have. In the RFP, we already have quite a bit of stakeholder involvement required in the contract, including meeting with all of the different parties that were involved. The legislation requests 10 or so members, and yeah, it says the RFP 24006 requires that the health consultant shall interview policymakers, subject matter experts, healthcare practitioners, health insurance providers, health officials, community members. As I read this legislation, it puts a lot of responsibility on the back of Geda. It doesn't actually put any funding, just putting that out there, but puts a lot of responsibility on Geda's back, and we're fine with that. But if we're going to be doing the heavy lifting, we are comfortable that there has been stakeholder engagement, and there will be more stakeholder engagement. And I believe in the legislation for the leaseback also requires stakeholder engagement. So there's a lot of stakeholder engagement already happening. I don't feel like we need any more of these, any more committees for this. In 2023, I think I was quoted as saying something to the effect of, we want to be transparent, but sometimes, you know, these bills give micromanagement. And if you're putting us in charge because you like us, you think we're competent and doing a good job, then we appreciate that. But if you want us to follow, if the RFP that we're already issuing, if you'd like us to disclose on a monthly basis how that's going or what they're coming out with, or here's their first draft, here's their second draft, you know, I will take that feedback, and we can do that. We don't need to put it in a bill. But relative to this bill, I don't know, we didn't do any research, our legal did not do any research about organic, not organic, we don't know anything about that. Nevertheless, we think that if you want to press forward, we could defer this bill for a couple more months to see how this study comes back. The engagement with this current study is supposed to take like 90 days. So if you want to table it, that's cool too. So in conclusion, Geda supports the intent of the legislation, things that make government agencies deliver services faster, better, cheaper. We tend to be on board with very much economic development driven. Nevertheless, this might be another committee that might just convolute the end goal, and so maybe if we just defer it a little bit and work a little more on it, I think we can press forward. All right, thank you.
Thank you. Is there anybody else that wanted to testify on Bill 13? And if so, please approach the table. No, if you could please stay. Before we get into questioning, I did want to put on the record that we did receive written testimony from two individuals, David John from John Family Trust, in support of a public-private partnership for GMH, and Isabel Flores also submitting written testimony in support. We will now begin with questions from the panel and from senators. Again, you have 5 minutes each, beginning with the author of the bill, Senator Terlaje.
Sujusmasi. I'm going to start with Geda. Geda, so you're saying that you issued an RFP, and according to what I found here, that was issued in August 2024. And it was also to review the current organizational structure, analyze other organizational structures, including public-private partnerships, state-federal partnerships, regional partnerships, privatization, privatized management, or publicly operated hospital and other structures. This RFP, when we asked you in January, we were told it's not yet awarded. That's issued in August 2024, not awarded in January 6. And we think, or one of my staff reported that she heard on the radio, Ms. Lillian from GMH reporting that the Geda RFP ended on February 3rd. She was on the radio, that it ended because of cost. So are you saying that your RFP is still, what's the status of your RFP?
Yeah, so the RFP was originally going to be funded under ARP. We didn't make the funding deadline. So we're just going to pay for it ourselves. Geda.
So is it awarded? What's the status?
Yes, that's correct. It's awarded. We'll issue.
When was it awarded?
January? End of January. And then both sides were, the contract was being reviewed.
All right. Do you think it's inorganic for Geda to ask about private partnerships or anything like that?
To ask that it be studied?
Yeah. Yes.
I do not.
I hope not, because you issued this, right? And it's been awarded. So, and then you talk about how we're going to, we have so much stakeholder involvement, but I beg to differ, because the reason we found out about this RFP is because we were having an oversight hearing on GMH, and that we saw it in the paper, we talked to them about it, they were not even familiar with it. They are the #1 stakeholder for any management of our hospital, but yet they were not involved at all. So, what are your funding sources for that RFP?
Geda operational.
Pardon?
Geda operational.
All right, thank you. And then, so GMH also, in their testimony, points out that, the governor has Organic Act authority to operate, maintain, establish public health services and hospitals on Guam. I totally agree. The Organic Act also says subject to the laws of Guam. And we also have laws on Guam that already authorize that the hospital can consult with private management, right? Private consultants. They have done this in the past. They do this apparently all the time, and so does Geda. This is not their first, I don't believe either. So I don't think it's and if it's subject to the laws of Guam, this is what exactly we're trying to do, make it a law so that everybody's on the same plan. And it's consistent with the RFP. How much do you expect your RFP to cost?
$125,000.
All right. And then another thing that, so GMH is opposing this bill. They opposed the last attempt to do this as well. And I really felt for you at that time and really tried to do what GMH asked us. Hold on a little longer. We are going to do this ourselves. We can do this ourselves. I believe we are very capable on Guam of doing this ourselves. My issue is we have seen, even at that time, that was 2020, I believe, and 2023, we came in with, we gave you more money than the governor had requested for your budget. I think we gave you more money than GMH had requested for your budget. And then we came in a month later because it was an emergency, because what GMH had predicted that they would do, they were unable to do because of computer crashes, the whole works, I don't know, but it was not able to do what they said they were going to do regarding revenue. And then we have this cycle repeating. We were not able to pay our vendors, so we put money in there. We were not able to repair the facilities, so supposedly the money was put there. But really, to me, what really just makes it almost indisputable for me is that when the money's taken away, this is the game that we cannot continue to play with GMH. It's like, we tried so hard to help you. We tried to give you money that wouldn't even get to you. We tried to fix every emergency that you had. And then you want to say, this is all a financial problem. It's not all a financial problem because we have done through supplemental appropriation. We have acknowledged, the government of Guam completely acknowledges we will always subsidize our hospital. But we've also taken care of a lot more of those non-payers, right? So on every aspect of our government, we are working on this and improving. But we still have, like you pointed out, Mr. Medical Director, Doctor, that we still have some uncollectibles, right? And that's why we're hoping perhaps that private partnerships are going to do what the government was not able to do, and that is collect against these private insurance companies, collect against I don't know. We've got a very good government of Guam self-insurance. The other thing is, one of the other things that was stated is that this is a violation of the procurement law. Could you just tell us how this bill would violate the procurement law?
When we process, Senator, RFPs, we really try and make sure that there's no conflict of interest and that, you know, when the proposals come in response to the RFP, there is the panel that will review those proposals and then they rate it. It doesn't get published, or it doesn't get, you know, like it doesn't come to the legislative committee.
You mean the responses or the RFP itself? Or the responses to the RFP?
The process of the procurement, the process of the RFP procurement. Okay, the proposals come into the hospital's materials management in a sealed envelope, in a sealed package. And so then the panel that are assigned to review those proposals, they go through the whole proposals, each proposal, they rate it based on the specifications that are put into the proposal. And if they're the scoring, but we don't publish it. I mean, it's not even discussed anywhere. It's just kept within that panel to review.
Oh, yes,
and so
absolutely.
To have it into a legislative committee, that again is not part of the procurement process.
Maybe you misunderstand, because the bill does not at all going to dictate who's going to get this award, how you're going to award it even, because that will all be dictated by the RFP, right? The request for proposals. And the proposals that come in, the legislature's not involved in that. We're only involved in this stage right here, and that is mandating that a committee gets together to create the request for proposals, the part that has never been able to be done. GMH said they couldn't do it. Geda didn't do it. They said the legislature should dictate and get all the stakeholders together. That was their recommendation. We are following their recommendation to get the stakeholders together to create the parameters of the RFP. It's only coming back to the legislature when you create your request, before you issue it out for responses. That request will be looked at by the legislature. We will solicit public opinion in case it wasn't solicited by this committee. And then we will send it, according to this bill, send suggestions back to the committee. And then it's up to, I think the bill dictates that it would be Geda, right, Geda? To issue the RFP.
The P3 committee. But again,
Yeah,
Senator,
so when that's issued,
maybe that's something that needs to be clarified in the
okay,
bill
well,
where it says
we
the
tried
committee.
to make it very, very clear because that was your objection to the last bill. So this bill is very different in that way. And the other thing is about cost. Of course there's cost. How could we enter into a contract and not pay them anything? We are going to pay, and what we are trying to do, we are paying so much right now on taxpayers. So nobody's fooling anybody that we are going to save the taxpayers any money or we are going to increase the cost to taxpayers. I'm hoping that's what the legislature is going to help us do, is prevent that. So we get a very fair and a value for value contract, and that we are able to dedicate almost the, relative to what we have been dedicating now, and which is huge amounts of money to GMH to continue to operate this. And I just also want to point out that if you looked at the requests for information responses that Geda obtained and sent, in their report, many of their at least one of their responses, the company that responded talks about their hospital, they operate, their operations, and they talk about Orange County Global Medical Center, Anaheim Global Medical Center, South Coast Global Medical Center, Chapman Global Medical Center, Hemet Valley Medical Center in Riverside County, California, and Menifee Valley Medical Center in the same county. Some of these other things, and they talk about, yes, there's different ways to do the RFP. That's exactly why we are getting a committee, so that they will flush that out. And when it comes to the legislature, we are going to give what we can afford, and they will be able to pick, if there are combinations of manage everything or just manage the EHR or manage whatever. And that's going to be probably based on cost, because at the same time, we will be still funding GMH. Nothing stops that. We can't stop that. But we've got to change what we're doing, because otherwise it's like a black hole that the money goes down and we can't even seem to move forward in facilities getting repaired. And we can't afford anymore that the money gets taken away from GMH. Thank you very much, Madam Chair.
Senator Taitegui.
Sujus Masi, Madam Chair, and thank you everyone for being here today to discuss this. I think it's a very important bill. In your testimony, you talk about all these great things, Lillian, that you wanted to implement with the next brain, the younger generation, bringing in new ideas and stuff like that. I'm just surprised that it's been this long and you haven't even done most of that. You haven't done a lot of things for the hospital to try and find a way to solve some of the issues that can be very, easily done. I mean, I remember in the 35th Guam legislature when you came in front of us and asked us for a minimal amount of money, and we wanted to give you more, and you didn't want to take it. I think just a small amount, and we were standing here ready to give you at least $10 million more. Then the following year, the same thing happened. We all know that the hospital currently, right now, needs to be addressed. I mean, before we even move forward, people are getting sick today. They're not going to wait for 5 years to be able to be seen. So we need to fix what needs to be done now. And if there's a public partnership that we can get into, and looking at the Organic Act of Guam that you mentioned, that it's against the Organic Act of Guam, other than that the governor has the authority to oversee healthcare. What section or what part of the Organic Act of Guam does not allow a public-private partnership with the hospital? That does not allow it.
It doesn't say that, but what
Exactly.
it says is that the governor has the authority and
But it does not say that it doesn't allow for a
to
public-private.
establish, to maintain, and to operate public health systems, including hospitals. That's how the verbiage is in the Organic Act of Guam.
Yeah, but it doesn't say that it does not allow it.
But the bill then contradicts it, because then this bill is proposing to then manage the hospital.
Okay, but if it's public-private partnership, isn't there a percentage of how much the hospital is run by a the public sector versus the private? Let's say you have 60%, of it is run by the hospital, while 40% is run by a partnership. I mean, has the hospital ever had a task force or a group speak of having a public-private partnership? I mean, I've heard in the past on the radio, I think the governor even said she was for public-private partnership for the hospital. So was there ever a discussion to discuss this?
I haven't had the discussion, but Senator, if you don't mind my saying that, we're not against the PPP, and as I said that, we're not against it. But the way the bill is written is where it needs to be then tweaked a little bit more. So it's a lot more clear in terms of the plan, and that there's also funding identified. And to Senator Terlaje's comment with regards to the RFP, the Committee on Health is going to be calling 2 public hearings to talk about the RFP or to review, which I think is
That was
not
explained,
really,
yeah.
in accordance with the procurement process. And those are the things that I just want to be cautious about. And
Right.
as Dr. Quasi mentioned, we need to really look through this more carefully and cautiously. We're not against it.
Okay, then a lot of times when testimonies come in front of us, they go through line 16, page 4, to strike out this section and incorporate this section, or the next page, line 10, page 18, things like that. But none of that was done here. It's just, okay, we need to look into it. We're not against it. But I think we're going to need a little bit more information from the hospital on your concerns with it. You talked about funding. Mel, I remember when I had a bill that was created for the hospital in 2019, a task force, to build a new hospital. And we needed some money. And I was, wise enough to come to you because we found about $1 million in, it was 100 and something thousand or something that, I think it was around that amount, that we found to support this task group. Now, you're talking about it's going to take for an RFP $120,000 in order for the RFP? Okay, what did you gave a money amount earlier to the...
Senator Terlaje asked how much the contract was for the RFP that we put out for the medical consultant, and I said it was $125,000.
Okay.
How much it would cost to issue this RFP?
Right.
It really just depends on how onerous the putting together of the RFP is. It's the time of all the individuals involved, but I think we should be, funding-wise, there's all obviously the publishing, the things that we're used to, right? The publishing, if there's any, there's going to be legal review of an RFP. If there's any special language, so for example, one of the things that I'm thinking about here as I read it is the P3 committee. Let's say the question comes up, what are you going to do with all those classified employees? So then the discussion becomes, do you roll in the continued and ongoing employment of classified employees into the P3, or do they become employees of the P3? Do they become employees of the government somehow? Are there 2 separate groups of employees running around the hospital? Or are you moving all the classified employees out to other agencies, right? So now that then starts a chain of events of, okay, let's do the legal research for where we go with this. Okay, I can see that type of, those types of things causing time and, needing help, additional help. But to run a regular procurement, you would probably, all these individual roles would be voluntary or as a matter of course of their role.
How much? How much would it cost? I didn't get an amount.
Well, because we're not at the point.
So an estimate, how much would it?
I wouldn't put an estimate on it. I think it's premature to put an estimate on it because you don't know how deep you're going with this.
Get started though, Mel, to get started. And if we were due with the SIDS where we found that money for the task force, would we go in that direction to try and find this funding there?
Do you want a full privatization of the hospital?
No, it'll be a public-private partnership.
In the form of a full, so the example that Senator used earlier, if they created a health system, so we call it the Guam Memorial Hospital Health System, and all of the employees were now, instead of being employees of the government of Guam, they became employees of the health system. Is that what you want, or do you want GMH employees working for the health system? Well, I'm asking you for specifics, ma'am, so I can come up with a number.
I just need an RFP. How much would it cost?
I don't know how much it would cost because I don't know the scope of what you guys are asking for.
Okay, so when you were doing the RFP for, not the RFP, but when you were doing some other projects that similar or very close to, how much did it cost you in that RFP?
So if we're doing an RFP for land, usually it's the cost of hiring the appraiser to tell us what the fair market value is prior to the RFP. It's any type of, if there's any type of environmental we need to do, especially for that land, then it's the cost associated with that. So it just depends on the RFP, ma'am. It just depends on how extensive the RFP is. Okay. The PPP in its current form is already covered in the $35 million annual appropriation. That is a leaseback. It's another form of a PPP. It's construction infrastructure PPP. Now we're talking about operations. We're talking about the CEO is the CEO of Guam Memorial Hospital Health System, or whatever you call the awardee. Is that employee an employee of the government of Guam, or is that an employee,
okay,
the CEO of that health system?
Yeah, I mean, you're just going around and around.
I don't think I'm going around it, Senator. I think I'm answering your questions. I think you're just not asking specific enough questions to give me answers.
Mel, there's a lot of variables. I understand.
Thank you, Senator Taitegui.
You mentioned there's a lot of variables.
Thank you, Senator Taitegui. Senator Sean Gubitauta.
Excuse me, Madam Chair. I didn't.
Thank you, Madam Chair.
Your time is up. Your time is up. Thank you, Senator Taitegui.
Thank you, Madam Chair.
No, your whole time, your whole conversation was counted toward the 5 minutes. No, we're counting your participation, your questions. Your time is up. Thank you.
Thank you, Madam Chair. First off, can I just say from a friend recently that good medicine still happens in Guam, so I'm not discouraged by that. I just want to say that just to start today, if I can, to kind of bring down the heat, if you will, today. But I just want to if I can, according to the bill's fiscal note that was provided by BBMR that was dated on February 14th, GMHA had yet to provide feedback on the measure. However, BBMR noted that GMH Administrator Lillian Posadas stated through local media that the hospital was looking into previous management partnerships to help make an informed opinion on Bill 13-38. So I know I think I heard it earlier, but for the record, if you can, Lillian, how does Bill 13-38 contemplate funding contractual requirements resulting from the request for proposal discussed in the measure?
Can you ask that again? I'm sorry.
Sure.
I'm still excited with your comment.
How does the bill, you mentioned it earlier, how does it contemplate funding the contractual requirements that are outlined that could result from the request for proposal for this particular action?
I still don't understand that question.
I think earlier you said, I have no money. So I'm trying to get on the record. Do you have money to be able to fund an RFP based on this?
Not right
bill?
now.
Okay, that's
we
fine.
don't.
No, that's what I wanted to find out. Thank you.
Thank you.
Also, the bill recognizes Public Law 33-143 by Senator Dennis Rodriguez, which required the Guam Economic Development Authority to develop a request for information. The purpose of the RFI was to determine how an interested contractor, hospital operator, would transition government operations of GMHA to a public-private partnership while continuing to provide quality care for the people of Guam. Now, according to Bill 13-38, and based on responses to RFI 16-001, Geda determined that there are at least 3 companies that may respond to a request for proposal. Now, the bill also cites Bill 305-35 by former Senator James Moylan, which proposed to authorize a performance management contract for GMHA. The bill states that Bill 305-35 did not pass into law due to concerns from GMHA, including that the measure did not adhere to Guam Procurement Code and additional assertions of GMHA's capacity or capability, to manage the hospital independently. For clarity, neither a committee report or a veto message from the governor is available on the legislature's website on Bill 305-35. Now, Public Law 3656 by Senator Joe San Agustin that was enacted in October of 2021, it authorized the government of Guam to enter into a leaseback arrangement with the contractor or developer for a period of up to 40 years to include the design, construction, and maintenance of a 21st century healthcare center. Now, Public Law 3656 authorized the government of Guam to pledge no more than $35 million from the general fund annually for debt service to support this 21st century healthcare center. Now, the bill requires that the GMHA, the P3 committee, to prepare and submit a copy of the RFP to the Guam legislature, and for the Legislative Committee on Health to conduct at least 2 public hearings on the RFP and transmit recommendations on the RFP to the GMHA P3 Committee for consideration, recognizing that there was some movement by the government of Guam nearly 10 years ago to gauge private sector interest in a public-private partnership for the management of GMHA. What role, and again, I want to get your input from the panel, what role, if any, should the Guam legislature serve in the establishment of such a public-private partnership by requiring an RFP to undergo at least 2 legislative public hearings? The legislature sets policy, it does not execute them. Can I get a response?
That was what I was pointing out in terms of the procurement process. You know, it's the agency that issues the RFP. Agency then makes sure there's funding before the RFP is issued or published. But the role of the legislature is, in our situation at GMH, we don't have funding. So I would, hope that there's that funding appropriated and included into this bill, but it isn't, because then it's going to be subsequent legislation that will be introduced to then appropriate the funding for the procurement of this public-private partnership. That's my understanding, but again, I hope that answers the question.
Mel, what do you think?
The question was, what is the legislature's role?
Sure.
Well, my job is to get all of the good senators comfortable that the amount that you set aside in things such as bond financing is sufficient to get the job done. And so in legislation, if I come to you for $35 million and then I say, the building cost went up and I come to you for 37, I come to you for 40, I will more than expect to be raked over the coals and asked why this is why it is. Sure. In advance, this is a lot of planning work that I don't think needs to be legislated. It's fine. It's not offensive to Geda that you want to legislate a committee. That's cool. It's more just from personal experience. Many times in the government of Guam, you ask us to do these projects, and it's like a group project where only one person is doing all the work. And what I've been finding is that's been Geda. And so I don't need you to tell me to call all these people to come to a meeting that I need to buy the ad and buy the donuts and all the things and report just so that I could write the RFP anyway. That's a very frank response. I'm really sorry. But it's, like I said, we're not offended by it. This is not legislation. When this came to us, my board chair, for God's sakes, put in a letter of support. Why? Because we like the intent of PPP. It's not something we stand in the way of. Do we need it at this juncture? Not necessarily, but that's why we recommended, we said, maybe give it 6 months, and then we'll come back with a study and see how you feel then.
Yeah, thank you for your candidness. Do I have time for one more question, Madam Chair?
Go ahead.
Thank you. How would this proposed requirement, there's a requirement in the bill to safeguard non-management staff members of GMHA, will it have any effect on any maybe policy recommendations by the P3? Particularly suggestions that are offered to help streamline daily operations to improve efficiency and reduce cost. In the bill, it requires that any contract established pursuant to the measure shall safeguard the employment and government-provided retirement and other benefits of all non-management staff members of GMHA. Anyone want to take a crack?
If I may.
Thank you.
Whenever a private company comes to form a public partnership, there's always an agreement beforehand. There's research that's done to find out what the needs are. In this example, there has not been a needs assessment, and so we don't know exactly what the needs are. Furthermore, there's no definition on exactly what the partnership would entail. Are we running operations for dietary, for radiology, or are we doing an operations for maintenance? I think these things need to be defined before we even get to the table. And in my opinion, that homework has not been done. And so we kind of begin to think about how the employees at GMH will be affected by this. I think this is very premature, in my opinion. I think this discussion is very good. It needs to happen because GMH needs to be run more efficiently. And I support it. I really support it because my job as a doctor shouldn't be to try and find supplies. My job as a doctor should be to try and make healthcare better for the people of Guam. That was what I came to be a doctor for. But honestly, I think at this juncture, having this partnership is just way too premature. We don't know what our needs are, to be honest with you. We don't know exactly what we want. And so before we can do that, we need to establish what that is. And to your question, Madam Senator Terlaje, yes, there are companies and hospitals that already have these operations. But again, these operations are for dietary, therefore environmental services, therefore services that do not have fluctuations in prices. It's very difficult to have a partnership with medical management. Every day, things happen on a daily basis that needs to be managed in order to make sure that the healthcare delivery happens appropriately. And these things are very difficult to have a partnership with. Thank you so much.
Thank you, and thank you, panel, for your service to the people of Guam. Thank you, Madam Chair.
Thank you, Senator Gumatata. And for the record, you did have 1 minute left on your time. Senator Vince Borja.
Thank you, Madam Chair, and thank you to the panel for your testimony today. I appreciate everybody's efforts to address the challenges facing GMH. While public-private partnership can offer potential benefits, I'm concerned about how this proposal will address the longstanding operational and financial issues at GMH, particularly its impact on patient care for Guam's underserved and uninsured populations. GMH is our only public hospital, and as we consider new management models ensuring improved services and access, this must remain our priority. So some questions I have today to better understand how this P3 will address the issues facing GMH. How do we believe this public-private partnership will improve GMH's ability to provide services to patients who can't afford to pay or are self-pay? Anyone on the panel?
Well, I'm not sure that they're going to be able to, because like I had mentioned earlier, even just the Medicare population that we serve, you know, the Medicare reimbursement, we're only eligible for 14 to 15 or 16 million, yet the cost is 31 million. So I'm not sure a private company will be able to then really increase the reimbursement for Medicare, because that's a federal, you know, regulated insurance coverage for the Medicare beneficiaries. Similarly with Medicaid. You know, again, they're under the CMS, and so that's another federal insurance coverage. They mirror Medicare in terms of reimbursing the hospital. So I'm not sure that a private company is going to even improve on the collection on the reimbursement for those populations. Self-pay, again, they don't have any resources. They don't have the source to reimburse the hospital. So, you know, private company, they're going to expect a return on their investment. And so I'm not sure that they're going to be able to increase the reimbursement, the collection for you know, that population. Recently, and I don't know if you've read the recent Trump's executive order is looking at cutting back on Medicaid funding, Medicaid reimbursement. That's going to have a significant impact, not only on the hospital, but throughout the island of Guam, because private clinics, if they're serving Medicaid patients and they're not going to get reimbursed, they may either shut down or refer all those patients to GMH. And guess what? We're going to then be slammed with those patients, and we're not going to be able to accommodate. So that's an impact that we're kind of concerned right now. Thank you for that question.
You know, considering some of the significant financial challenges, including debts to vendors and budget shortfalls, how do you think this partnership will resolve those financial issues?
Maybe through a private partnership, because of the limitation that we experience with procurement of supplies. You know, we have to go through such rigorous procurement process. A private company may be able to procure those supplies on a much more quicker, more efficient, and so the supplies, as Dr. Mkwasi says, he shouldn't be worried about getting supplies. His job is to take care of the patient and do the surgery. But, you know, this is where probably the private company can then get the supplies, procure the supplies quicker, and then be able to pay, hopefully, the vendors so that they can provide the supplies. Thank you.
Do I have more time, Madam Chair? One more. You know, just based on your experience and your time at the hospital, In terms of the day-to-day at the hospital, how do you think the partnership will address the current operational inefficiencies and improve patient care?
I'll be transparent. We do have quite a bit of inefficiencies with our hospital because, again, like our, infrastructure, it's antiquated. A lot of our staff were doing processes manually. Even the recruitment of applicants, it's a manual process. We're trying to, digitize and go through electronic processing. So maybe this is where the private partnership can then help us move towards a more efficient processing of our systems, our paperwork, minimize the paperwork. That's how I see it. Did that answer the question?
Yes, thank you.
Okay, thank you.
That's it, Madam Chair. Thank you.
Thank you, Senator Borja. Director Arreola, did you want to comment?
Thank you, Senator and Senators. I wasn't going to testify on Bill 13, but when my colleague Lillian brought up Medicaid and Medicaid rates, I was like bouncing off my seat. So as you know, the Department of Public Health and Social Services runs the Medicaid office. And I just want to reemphasize what Lillian mentioned. I'm not going to talk about private partnership. I'm just going to talk about the realities. And the realities is the Medicare rate, which you and I do not control, is lower than the cost. So we can come up with all kinds of possibilities to make things more efficient that can, as maybe procurement, maintenance of housekeeping, maybe maintenance and things like that. But the realities is the cost of reimbursement is neither you or we can't do anything about. Honestly, this isn't a congressional level. We need to advocate for Medicare reimbursement to be increased. If it's increased at the federal level, guess what? Lillian will get more reimbursement. The government of Guam doesn't have to subsidize. Medicaid will get reimbursement. Why? Because we mirror the Medicare rate. So I just want to emphasize that the reason why the government of Guam is so committed, and they are, because millions of dollars has been put into our only public hospital and has been also given to public health for Medicaid, is because you're subsidizing something that is lower than our cost. So we need to just realize that in the beginning, that we will always subsidize. Unless the Medicare rate increases, we will never be able, we will always have to subsidize. And unfortunately, Medicaid is in that boat. We mirror the Medicare reimbursement rate. And as I mentioned earlier, Medicare rate is nothing that you and I can do. That's at a congressional level. Now, unfortunately, the new administration, the Trump administration, I've been on calls for the last 2 weeks at 5 in the morning, anticipating major cuts to Medicaid. And we will deal with that and come to you for help when that happens. But the writing is on the wall, and we just need to brace ourselves, which means the hospital's concerns are even going to get worse. So I was just bouncing off my seat because I just wanted to emphasize that it's nothing that you or I can do. The Medicare rate is not dictated by you or I. It's dictated by Congress. So unless it moves up, we're on the same boat every day.
If I may just piggyback on what a director said, let's be realistic. Most of our patients are either Medicare, Medicaid, or MIP. MIP pays even less. So if you look at our payer mix, we are not a favorable environment to make money for the hospital. The hospital is not a business. The hospital is meant to take care of people. The only way we can make money is if we improve our payer mix, to have more patients that are private insured, through some of the private payers on Guam, like Select Care, Take Care, and so forth. But with such a large percent of self-pay and a large percent of Medicare, Medicaid, MIP, we will keep coming to legislature to ask for money. If it's not me, it's going to be whoever takes my job. It's just a fact. But I do believe that we should find a way to make this hospital more efficient, whether it's with a private partnership, private-public partnership, or whether it's with trying to enforce legislation at the Congress level to augment our Medicare reimbursement. It's not only the reimbursement, we're arguing with insurance companies to collect money because they don't want to pay. This is the reality of this hospital, unfortunately. Thank you.
Madam Chair, if I can mention, it seems, because I know we're talking and focused on the hospital, but for the record, a lot of private companies come to me every day. I mean, at least one private company comes to me every week, asks me, Therese, can you increase our Medicaid rate? And what do I say to them? If I increase the Medicaid rate for your service, we have another issue. We have a cap, right? We all know we have a Medicaid cap, something that other states do not worry about. So we have a cap, we have a limited rate that none of us on Guam dictate to reimburse. So I just want to say, I know that we're talking about GMH, but trust me when I tell you that talk to any private provider, they're struggling as well in their private clinics, asking, how can we get better rates? And I don't know what to tell them. I mean, I had a private company come to me. Their patient mix is 10% Medicaid. I'm sorry, so out of 700 patients they serve, 100 is Medicaid, 600 is Medicare. They want me to increase the Medicaid rate to just make it balance. It's not going to happen. Why would I hold Medicaids back for 700 people when only 100 of my people are visiting their facilities? So again, we're concentrating on GMH, but GMH is not the only one. Private companies come to me all the time. What can we do about the rate? And unfortunately, the only thing I can tell them is, unfortunately, it's not even at our territorial level. It's at a congressional level. We need to advocate for, 1, higher Medicaid reimbursement rate, 2, a cap, a lift of the cap. Now, is that going to be possible in light of the new administration? I don't know, but I just try to be hopeful every day. Thank you.
Thank you. Senator Chris Barnett.
Sido Swasia, Madam Chair, and thank you to the panel for your testimony. Ms. Lillian, in your testimony, you say that the Guam Memorial Hospital is not against a public-private partnership model. However, you don't support the proposal and process proffered in this bill as it is written. I'm just trying to gauge your support of the measure because you did also say that you felt like the bill just needed a couple little tweaks. So could you kind of explain what type of public-private partnership model you would support?
It's not just the model, but I think the details of, as Dr. Naomi mentioned here, we need to have some specification. What is the public-private partnership going to focus on? Because, is it going to be the entire hospital or just a portion of it? Whether is it going to be the housekeeping or environmental services? Those are the things that I'd like to see in the details, so it's clearly written out.
In my read of the bill, it seems to me like those things would be determined after the formation of the task force, which would then look at the different areas of. But we're trying here. It's very frustrating. We're 6-7 years into an administration where the people of Guam were told elect a nurse for the people's health care, and look at the state of our health care. We have the chair of the health committee saying our hospital is an F. We've got the public health clinic in Inlan being used as a warehouse. We have the public health clinic in Mailao sitting idle, abandoned. So in the legislature, we've tried in the 37th, they tried in the 36th, we're trying in the 38th to do something to affect some kind of change. Because when I read your testimony, with Ms. Lilly, with all due respect, you quote the Organic Act, and you say the governor shall establish, maintain, and operate public health services in Guam. And I just have to ask, how's that working out for us? Not too well, I'd say, with all, all the support and appreciation for all the hardworking employees across all of our different healthcare systems, but our healthcare system, it's in a shambles. And so we're trying desperately to find out what will work. And when you have nurses coming in here to the legislature talking about, how politics has paralyzed our people's progress relative to healthcare, when we, routinely bail out GMH with $30 million, $20 million, and then you have the governor stealing money back from our people's hospital. I mean, that's why the speaker's coming up with these types of proposals, is because we're trying to do better by our people, because I think we can all agree, when you look out across the landscape of our people's healthcare system, it leaves much to be desired, and they deserve much better. So I don't really have any questions. I've heard a lot of these answers, repeatedly over the last 2.5 years. And I think that, in order to really hold our leaders accountable for the state of our healthcare, we're just going to have to step on some Organic Act toes. That the governor has this Organic Act responsibility, but in my opinion, she's failed in delivering that responsibility, with all the due respect that is due. I think, if you look across the island, I mean, GMH, right, we hear about it every day. We hear about not just the condition of the facility, but the lack of, basic supplies like catheters, paper towels, for crying out loud. And so for me, it's a little tone deaf to hear you, and I feel for you. You got to come in here and you got to defend this broken model that absolutely is not working, and you have to come in here and kind of engineer your testimony about just defending the governor's authority over healthcare, when it's clear that I don't believe she's using that authority to benefit the people of Guam, and I think the proof is in the pudding. So just masi, Madam Chair, for the opportunity to speak.
Thank you, Senator Barnett. Senator Calvo.
Thank you, Madam Chair. Thank you so much to the agencies, organizations, and individuals who testified on Bill number 1338, COR, today. Your insights, your expertise, and experiences are invaluable as we consider this critical piece of legislation. There is no question that Guam Memorial Hospital is facing serious challenges, from financial shortfalls to staffing shortages to aging infrastructure. These issues affect the quality of care, patient outcomes, and the hospital's long-term sustainability. Given these concerns, it is understandable why a PPP, or public-private partnership, is being proposed as a possible solution. The private sector could provide resources, operational expertise, and financial stability that our hospital desperately needs. At the same time, you must ensure that any proposed partnership truly serves the best interests of our people and does not create unintended risks or consequences. I recognize the urgency of addressing GMHA's challenges, but I also believe that we must proceed carefully, ensuring that we are not rushing into a solution that may create new problems down the road. Now, I am the type of person who does not say no right away when something is proposed on a table or we're creatively thinking of
a solution for a problem that has been around for ages. So I don't really have a question, but I have a few remarks. And I wanted to say that I've seen a lot of PPPs that are successful, and there are PPPs also that did not work out. So there's a lot of work and diligence and vigilance that need to be exercised for us to proceed. But I will tell you, the potential benefits of PPP would be as follows. Financial stability is one. We don't have to borrow. We don't have to float bonds. Somebody will just come in and provide financial backing for us here in Guam. If you ask me, truth be told, I do not want to incur more debts for Guam. That's me. PPP brings in improved healthcare services, efficiency and innovation, job and benefit protections. Job protection was raised earlier in the testimony, and you know what? With PPP, it can still be protected. Public oversight and accountability is another factor. But on the other hand of the scale, one of the things that I am concerned about would be private companies might prioritize revenue over patient care. So that's one thing for me that is very, very vital. I want to make sure that the people of Guam is protected. I do like, to be honest, I am inclined to, I see the beauty in forming a committee because, to be honest, I was jotting it down and I saw that it is actually composed of healthcare, government, and financial representatives. And for me, medical experts, their opinion should be considered because it actually brings in transparency and inclusion. And obviously, we want a PPP that will be run by majority medical professionals. I do wanted to raise something that Dr. Nyame brought about. And this is also a good thing because I've seen this happen, or this had been a practice, and it has been a successful, not just partnership in other places, but BOT. Doc, you mentioned about BOT. Now, for people who doesn't know what BOT stands for, it's build, operate, and transfer, which is actually very good for our community as well. It's something that we should actually explore. It's been explored many times over for decades in other places, and it's something that we should take a look into here on Guam. Now, I do understand that this bill that proposes PPP for hospital is not really a bill about privatization, but rather it's an effort for sustainability. So I will keep an open mind with regards to this bill. It's something that there's a lot of cons and that I see, and pros that I see, but several cons that I like to delve into. But I don't really have any questions because you all satisfied my curiosity and my thinking today. It's mostly just remark, and I just want to thank everybody and thank you, Madam Chair. That's all. Thank you.
Thank you, Senator Calvo. Senator Parkinson, I apologize, I didn't recognize you when you walked in, but thank you for being here. Questions?
No, I have no questions at this time. Thank you.
Thank you, Senator Parkinson. I do have a question, and it was about a year ago. The governor and lieutenant governor endorsed the concept of moving public-private partnership to manage the hospital forward. And it was in an article in the Guam Daily Post February 28th, 2024. At the time, the governor had assembled a fiscal review committee, which was tasked with reviewing and making recommendations regarding various financial and contractual issues at the island's only public hospital. Lillian or Melanie, anybody, we did ask the governor's office to attend, but does anybody know of the findings of this actual report, or if there's any updates?
I attend the monthly fiscal review committee at DOA with Director Byrne and our CFO, Ms. Yuka. And oftentimes when Mr. Lester Carlson is available and not in another meeting, he attends it. And also with the Deputy Director, Lisa Fisher. But I have not seen any report on that contract or the contractual report that you're talking about. I have not seen that report.
And how often did you say you meet every week?
Monthly, every month.
Every month?
Right, except for this month, it got rescheduled for March because Mr. Byrne had to go off island.
I see. So you've been meeting for the past 11 months?
Monthly,
yeah.
Quite consistently, but there are times when we, missed a month meeting.
Can you provide any kind of information on what kind of results or what you guys talk about? I mean, this was to review, the fiscal issues with GMH. Can you?
Correct. Absolutely.
Are you guys going to be producing a report so that we know what's going on, or the public knows what's going on? Or
nothing really written in terms of what was discussed, but we do discuss primarily the financial situation of the hospital, and our CFO provides the DOA director the monthly financial report in terms of accounts receivable, accounts payable, how much we're billing, how much we're collecting. And so those are provided to Mr. Byrne and Lisa, and we discuss it. He reviews it, and we discuss it. We recently discussed also the Medicare cost report that we provided for a 10-year period to see how we can then move forward with doing the Medicare rebasing option. So hopefully he's still reviewing that report, the 10-year report that he received. And so there's possibility that we may get some Medicare rebasing money. We just haven't seen the official report ourselves. Mm-hmm. Mr. Byrne said he's reviewing it still.
Okay, and is this related to TEFRA?
Well, the TEFRA is what dictates our reimbursement rate. Mm-hmm. That's the Tax Equity, Fiscal Responsibility Act. That's what dictates how the GMH or Guam hospitals are to be reimbursed. That's what TEFRA is, and it is Medicare who then provides the reimbursement. So the Medicare on a yearly basis, we do a cost report for the previous year, how much it cost us and all the very details. And so for the 10-year period that we provided Mr. Byrne, he submitted it, I think, to Medicare, and he got a report back. So there's possibility that we will get some rebasing money.
And do you have a rough estimate on how much that is?
No idea. He hasn't, he's still reviewing the report. He hasn't shared what the findings are and how much that's going to be.
But right now it's at about 14 to 16 million, according to your testimony.
But we spent 31 million to provide the services.
So hopefully 31 million?
I don't know, because they go through a formula process to then do a settlement, is what it's called, a tentative settlement for what then they owe us per the discharge rate, which is a different rate compared to the per diem that they reimburse us on a daily basis. Okay, but
so you might have like an estimate, I would assume, on how much you think you should be reimbursed?
Based on that Medicare cost report that Mr. Byrne received,
31.
I don't know how much it's going to be, but he thinks that there is a possibility we will get some reimbursement.
Okay, thank you. Mm-hmm. Senator Terlaje?
Thank you.
Thank you. Senator Terlaje, I'll let you close.
Situs Masi, Madam Chair. Thank you again to everyone who's testified and to my colleagues as well for reviewing the bill. Oh, wait. Sorry. I just want to again remind everyone what's really in the bill to allay some of the fears maybe that have been stated today. And first of all, it's to create a committee that's going to write this RFP. The RFP that was recommended years ago that was just not able to be written by Geda to date, the RFP that hasn't been written by the hospital to date, the RFP that the task force recommended, the task force that I read their names, included very prominent people, financial experts, Dr. Lizama, David John back then, our governor as a private citizen back then, I believe. Many people and they all considered the different models, and they all recognized the risk of Medicaid rates, Medicare rates, and they still recommended that we should consider a private-public partnership, but the parameters should be defined. And that's what this committee is going to do, is define those, or define the options for us. And then it comes to the legislature so that we can define what we can afford, right? And so that's why it comes here, so we can avoid the risk. Or if it says, take away all the retirement of the employees, hopefully we can avoid the risk somehow by, I don't know how, you know what I mean? But that's why it comes back, so that we can make suggestions for this RFP before it goes out, and we can show them what we can fund, so that we have a real movement, a real contract going forward. The RFP committee that the bill sets up, again, it's government officials, it's going to be our directors, our top fiscal officers, it's going to include GMH, of course, the stakeholders, and it's going to include the Medical Association, the Medical Society, the Guam Nursing Association, their Director of Public Health, and I'm sure they will be able to engage, experts as they find necessary. But again, we're going to be able to abate the risk. They're very aware. No one's going into this thinking we're getting anything for free. The taxpayers, least of all, they have been paying this all along, and it keeps getting higher and higher, and they are doing it. It's them. And so all we ask is not that we're not going to have to subsidize. We will subsidize. I think that's naive to think we will not have to subsidize, even with a private partnership. However, what we want is just to ensure that when we do that, that money is, the taxpayers' money is put to the best use possible. The taxpayers' money or the federal funds that go into GMH are not going to be removed, and that GMH is going to be able to do what it sets out in its plan to do, what this contract sets out they're going to do and GMH is going to do, so that everybody's very clear and really no more interference, and they continue to move forward. This partnership was not contemplated in the previous legislation where we authorized the design, construction, and maintenance of a facility, right? We did that. That's done, that's good. You're going to go out for financing on that. We authorize all kinds of flexible financing. This is what we're trying to do here. GMH has done the same thing in small ways. They've gone out for private partnerships with consultants for different things, their EHR systems. There was one that the auditor reviewed and didn't like that you went out for this consultation because they didn't think the deliverables were adequate in the end. Remember that? So I don't think the concept of entering into public-private partnerships is inorganic in any way when the Organic Act says subject to the laws of Guam. I think it's very consistent with laws that are in place on GMH's enabling legislation. It's consistent with what GMH has done over these years. It's consistent with what Geda's doing right now. We found out last year they went out for an RFP. And what we want to know is just, we have to do this rebasing. We have to do all these things. And we just want to make sure this plan is going to designate who's going to do what. Hopefully, it's going to make this set as soon as possible. I'm not in a rush to rush us into anything, but we are at a critical juncture here. We are building a new hospital. And I don't think anyone wants to go in there feeling like we are not sure how that's going to be run. We are not sure what's being put in there, or whose expertise are we relying on to do that. And if I could just ask, Melanie, all the ARP money that was given to Geda, you've got the pot for the new hospital. Is that being spent in consultation with any hospital expert or this management consultant? Because my understanding it's being spent for infrastructure.
It's being spent for power, water, wastewater, and for land preparation.
All right. And so that's why I think if they're in now or soon, these private partners will be able to help us in our new hospital as well to ensure that it will be run efficiently, that we will not suffer these same limitations that we are now. And of course, we are partnering. So the government is still going to have to pay, but hopefully we're just putting our money to the best use possible. And GMH staff is still going to have to be there and work for sure. But it's just, yeah, we just want to have a good plan. And so I think we're going to be able to take care of the risks because of the people involved, because of the oversight involved, because of when it comes back, the public will hear it. We're going to bring them along so they all know what's going on. I think this is going to help the hospital. When everyone knows your plan, we know where we're taking a risk, and we all join together in that risk, as opposed to finding out later that without our consent, we are now going to pay much, much more because of risks that were taken in the past. And I think bottom line for all of this, of course, is to make sure that we, in partnering, are going to still be able, as a government, to provide for the care that's not provided in any other hospital. This is why we are so, we want GMH to succeed. The whole goal of this, you have to succeed, because that's the only place, as we have reminded all the time with maternal child health care, the only place with so many things over the history of Guam. And we are going to continue to see those challenges where private hospitals, naval hospitals are not going to give us those services, and we are going to have to do that for ourselves. So we have to succeed. We have to provide these services, make sure in our overview that they are being provided, what we feel is the most important, and that patient care, bottom line, patient care. And all of these people, I believe we do have people who have stayed on Guam to serve the population of Guam. Despite the higher salaries in the States, they stay here, they serve in the hospital, they serve throughout our island because they love Guam and they want Guam to succeed. They want the hospitals to succeed. So thank you again, Madam Chair, for having the hearing on this bill, and thank you to all of you for your input. Sizusmas.
Thank you, Senator Terlaje. And thank you to all of you who testified today. Mr. Salas?
I just wanted to say something about this partnership. I haven't heard anything about the compact. Does the compact have any effect with this private partnership? Like our compact residents, the services that we provide? Because we're talking about Medicare, Medicaid, and MIP. And our MIP is going to be depleted with a lot of our compact folks being paid. It's 100%. So I don't know, are they a player? Does the compact impact our players in this PPP?
Go ahead.
Yeah, Mr. Salas, thank you for that question. I think the Director of Public Health could confirm, but last we heard, compact citizens, residents on Guam now are covered under the Medicaid, and that was a big, huge accomplishment that due to all our collective efforts, so thank you very much. They are covered now under Medicaid. So the goal or our challenge is to get anyone who's not covered under Medicaid as well.
If I may, yes, that's correct. Patients that are under compact that come to the hospital will be treated. We cannot turn anyone away, and we do not turn anyone away. However, trying to get patients that are compact on Medicare, Medicaid is very difficult. Sometimes they don't go to the centers to fill out the application to actually finish the application for insurance. So a lot of these patients are self-pay. Because they're self-pay, they don't actually contribute anything to the healthcare costs. So a lot of times we treat them, but we don't get compensated for their care. So this partnership will have to take that into account to take care of these patients without getting compensated. That's one of the problems we have at GMH. patients show up that can't afford the health care. But because of the public law, we can't turn them away. We have to treat them.
I understand that, but my situation is, if we're going to care for the compact folks, I'm lost there, but anyway, yeah, I'll give it to the public health director.
Thank you. As Senator Terlaje mentioned, the compact votes through the compact agreement between the United States and their countries are now eligible for Medicaid. Now, the challenge is to get them enrolled. What public health has done was, it's not enough to just do a call out. They don't come and they don't bring the right documents, and it's human nature, right? But because we want to help our sister agency, the GMH, because if they're not on an insurance like Medicaid, then they're going to be self-pay. The realities are self-pay is slow in being paid. So even if they signed an agreement, if they pay only they can only fire $25 a month, it's like a drip in the bucket, right? So the best option is to get them into the Medicaid rolls. Knowing that it's not that easy, just because it's available, they don't come swarming in to apply. We have taken that a step further at the Department of Public Health since I've been there. I've met with the FSM Consulate. I'm working with nonprofit organizations that are helping us bring groups of FAS citizens who are qualified for Medicaid, and we're doing major outreaches and enrollments. So we're doing everything we can with the consulates, with church leaders, any place that they congregate or they come together, we're trying to get them enrolled. And so that's what we're doing. Now, can we capture every single person? Probably not, because if they don't want to come with their documents, they don't come in their documents. However, through a partnership with GMH, there's an established eligibility specialist at GMH. And the minute we find out that they are not on the Medicaid rolls and that they qualify to be Medicaid, they're actually enrolled at the GMH property. They don't even have to come to a public health center to be enrolled. So we're doing everything we can. All we need is everybody, the whole island, to just get your friends and families who do qualify to get enrolled. And that's how we're going to narrow the gap. Thank you.
Thank you. And that concludes the hearing on Bill 31. We're going to take a brief recess, 2 minutes, and reconvene for the public hearing on Bill 31. Thank you. Welcome back. The Committee on Health and Veterans Affairs is now called back to order. We will now proceed with testimony on Bill 31, introduced by Senator Will Parkinson. At this time, I ask those who signed up to testify to please take a seat on the panel. Before we get to testimony, Senator Parkinson, you have 10 minutes to provide your opening remarks on your bill. Senator Parkinson is going to do his introduction of the bill.
Thank you, Madam Chair. Good afternoon, everyone, and thank you all for being here today. I'd also like to thank the Chairwoman, Senator Matanane, for hearing Bill number 3138 today, an important piece of legislation that seeks to expand options for assisted living here on Guam. Guam is facing a critical challenge. Our aging population continues to grow, and we must ensure that our elderly, our manamko, have access to the care and dignity they deserve. For too long, there have been significant gaps in the continuum of care on our island. Many seniors require assistance beyond what independent living can offer, but do not yet need the intensive care provided by nursing homes. Assisted living facilities provide that essential middle ground. A safe, supportive environment that allows our elders to maintain their independence while receiving the necessary support for daily living. This bill is to address that gap by establishing a comprehensive statutory and regulatory framework for assisted living facilities. To ensure financial sustainability, the bill leverages existing government programs, such as the Medically Indigent Program, the MIP, and expands Medicare and Medicaid reimbursements and encourages public-private partnerships through federal grants and investment incentives. While the Qualifying Certificate Program under Public Law 36-111 offers economic incentives for development, it does not provide the necessary legal and operational structure to ensure high-quality care, safety, and oversight. Bill 31-38 seeks to rectify this by setting clear standards for the licensing, operation, and management of these facilities. This legislation will not only improve our quality of life for our elderly, but will also create jobs and stimulate economic growth in our healthcare sector. I look forward to hearing testimony today and discuss how we can implement these funding mechanisms effectively while keeping healthcare costs manageable for the government and private sector alike. With a little bit of my time, I'd like to read in the testimony of Mayor Jesse L.G. Allig, Mayor of PD and President of the Mayor's Council of Guam on Bill 31-38, and read it into the record. It's a very brief piece. In 2017, my father suffered a stroke in Oklahoma that caused him to be severely debilitated. He received the necessary medical treatment and subsequent therapies to allow him to lead the best possible life. After all the treatments and therapies, my father is still unable to live independently. He currently resides in a residential care facility in California, where he receives quality health care and the activities of a typical lifestyle 7 days a week and 24 hours a day. As much as he wants to come home, Dad will not return unless there is a facility in operation that provides unrivaled care in order for him to live the highest quality of life. Typhoon Mawar presented us many opportunities for improvement in the government of Guam. The mayors worked tirelessly to assist residents pre- and post-disaster. Most of these residents were elderly or living alone. Their children and grandchildren either lived in another village or relocated for various reasons. Our government should be concerned about the quality of life we provide our manamko. and everyone that calls Guam home. We should pave the way for business development that will offer our people alternatives and options to live their best life. Assisted living facilities provide solutions for our veterans, Manamku, and quite possibly the homeless. These communities are created to give residents the proper health care and way of life every human being deserves. Certain facilities should accept Medicaid, MIP, veterans benefits, and health insurances. Housing and care opportunities for everyone nearing their final stage of life must be addressed because it is our Chamorro culture to take care of one another. Bill 31-38 is the impetus to the development of assisted living facilities on Guam. I urge the senators to work with all the government agencies, developers, businesses, and stakeholders to pass a bill that will ensure the swift construction of these facilities to meet the needs of our Manamku and the people of Guam. Zeus Maasi, Jesse Mayor Alec. So, this letter stuck out to me because he is me. He is the people of Guam out there who are suffering through this same burden of having to take care of our family without the necessary tools here to do so. And so for this reason, I asked my colleagues to give us your best ideas on how we can make this idea as strong and as good as possible so when it makes it to the session floor, we can give the people of Guam the best possible bill we can have. So thank you again, Madam Chair, for hearing the bill, and I look forward to hearing more of the discussion. Thank you.
Thank you, Senator Parkinson, and I look forward to working with you on this bill as well. We will now begin with public testimony, and we'll begin on my left. If you could please state your name and what organization or if you represent a government agency.
Buenas and good afternoon, Madam Chair, committee members, and senators present here this afternoon. My name is Peter Alexis Ada, a Barrigada resident. I am here to testify on Bill number 31, proposed by Senator Will Parkinson. Let me begin by commending Senator Parkinson, who has a strong vision to see nursing homes built on Guam, which is badly needed. This legislation is something that would help future potential builders. In the article that I just, or the written testimony, I had written it as Public Law 131. Please forgive me, it's supposed to be 111. My apology, Senator Terlaje. Public Law 111-36, introduced by Senator Terlaje, is similar in its intent. That's offering qualifying certificate that enhances anyone who to include local and outside investors to build nursing homes. Public Law 111 and Bill number 3138 would help two potential locals who are seriously considering of opening a assisted living home on Guam. Senators, after reading the full text of Bill number 31, I noticed it is geared towards nursing home and not assisted living home, to which I am in the final process of establishing an assisted living home on Guam. It should be noted that there isn't anything currently that addresses assisted living homes on Guam. There is a nursing home policies, but, excuse me, there is for nursing home, but nursing homes and assisted living homes are totally two different in concept and design. I've invited the inspectors of the environmental health, of public health, and the inspectors of DPW to come and see on site what they advised of what needed to be done to comply with Guam laws. Public works inspectors were not able to make it to the meeting, but I knew that we needed to renovate certain rooms, if not all, to comply, to be ADA compliant. That is common sense. It is at this point that the public health said that there is nothing in the law, in the current law, that addresses assisted living home. They have it for nursing home, and it's right here. Senators, this is the very reason why I am here, requesting that we need rules and regulations addressing specifically assisted living homes so that we can we can follow the policies and do not open. Then someone comes and says, you didn't do this, you didn't do that, we will have to close you. This is exactly what I am trying to avoid. Senators, as of early last night, there are 19 patients at Guam Memorial Hospital and SNU that are ready to be discharged. 2.5 hours ago, I received an update. The number has now increased to 22. These people could have been discharged from Guam Memorial Hospital, but these patients do not have no place to be released to or place to go. Some have no families on island to take care of them. This is where we come in. Families on Guam prefer to have their aging parent at their own home and enjoy the familiar surroundings and in their own beds. In some cases, parents live at home, but some families have to go to work, and children go to school, leaving Nana and Tata alone. This is extremely dangerous, Senators, and the families don't want to put their parents in this situation. This is where we come in and offer them an alternative for them to consider. I was talking with an official from Gura, and they said that they have approximately 100 applicants who may be in this situation. The question is, who needs it most? Our organization is called Guma Oru, and is working to obtain grants from nonprofit 501c status for funding. I need to emphasize that we are not a skilled nursing facility like St. Dominic, and unlike Guma Tranquilidad, who may have some services. We offer on-site services covered under the grant at no cost. The resident patient, the only thing they pay will be directly to the hotel is for their unit. I have worked with the hotel owner to spread the security deposit to 3 months to help the applicant. To dish out your payment of an amount and then require again to pay for a security deposit, that can be so hard for the family. I've been able to work it out with them that they will spread it out in 3 months. This particular hotel includes full kitchen facility, microwave, water, power, cable, internet, and backup generator. I have 5 years' experience as manager of the Elderly Housing Program of Catholic Social Services. I found and ran for a couple of years the Guam Medical Referral Office, overseeing the referred patients from Guam to medical facilities in Honolulu, Los Angeles, and the Philippines. My experience in the health industry is wide range. Some potential residents could be self-pay. Some may have Medicare, Medicaid, and may have only Medicaid that may qualify them to include caregiver service. Some families are able to pay for their patients' stay to include payment to the caregiver if the order by the primary physician and qualified. I should stress that Guma'oro requires a doctor's referral in order to be admitted. Anyone can apply, but the question is, who needs it most? I want to help Guam Memorial Hospital to avail rooms for those needing to be admitted and not have to wait in the ER or the hallways. Guma'oro will have a social worker, a physician's assistant, security guards, transportation to and from their appointments on a daily basis. Our services will be 24 hours. Guma'oro will be located in within proximity of GMH, GRMC, naval hospitals, most doctors' clinics, most dialysis treatment centers, and wherever the new hospital is built. I have done my research in finding the average cost of an assisted living home, and anywhere between $4,500 to $54,000 monthly in the United States. Senators, we don't even come close to that. These companies are privately owned for profit. We offer more services than those offered in the mainland. I have personally visited 13 senators and waiting for 2 more senators to schedule me to discuss this issue. I only hope and pray to see that all 15 senators will be able to be the sponsors in this final legislation prior to voting. Our board of directors consists of me, the founder, president, and CEO, Dr. Vince Akamoto as vice president, Ms. Frances Manibusan Adam, who's right here with us, who is the secretary-treasurer, Ms. June Taitno, who is also here with us, and she is representing the general population and a veteran herself, and Mrs. May Ada, and she is also here. We want to start small, nothing big, but we want to perfect that small and increase it upon the availability of the grant funds. Senators, thank you for your time, and I hope and pray that this issue will be addressed as quickly as possible so we can help those in need. Senators, we need rules and regulations in the books to address assisted living homes, and the need is now. Si Zeus Maasi to all of you.
Thank you, Mr. Ada. Ms. Sariola.
Thank you, Chairperson Salas, Matanane. Senators, first of all, let me, this is the first time I've come before this 38th legislature, so congratulations to you all. And together we will work and do great things. So I have provided with you testimony. I hope you have copies. before you, and I'll just go through it for the viewing public. Hafaday, Senator Salas Matanane, Committee on Health members. My name is Therese C. Ariola, Director of Department of Public Health and Social Services. Thank you for the opportunity to present testimony in favor of Bill 3138, COR, an act to amend Chapter 7 of Division 1, Title 10, Guam Code Annotated, and add a new Chapter N to subsection 9302B1 of Chapter 9 of Division 1, Title 26, Guam Administrative Rules and Regulations, relative to expanding options for assisted living facilities. DPHSS would like to commend the bill author, Senator William Parkinson, for recognizing the amendment of Chapter 7, Division 1, Title 10, Guam Code Annotated, to strike through nursing home and replace it with assisted living facilities. The amendment to Title 10, Chapter 7 will provide the amended rules and regulations with qualifying certificates aimed at the development of assisted living facilities. DPHSS testimony includes input, comments, and recommendations from the Division of Senior Citizens, the Division of Public Welfare, Medicaid Office, Division of General Administration, the Health Professional Licensing Office, and the Division of Environmental Health. Under the Division of Senior Citizens, the National Center for Assisted Living State Regulatory Review 2024 edition overview states, assisted living communities are a long-term care option, preferred by many individuals who typically need help with everyday activities and some health care services, but typically do not require 24-hour skilled nursing care services for extended periods of time. These communities offer a unique mix of companionship, independence, and security, and become residents' home, prioritizing resident choice, dignity, and privacy. The assisted living model is built on the concept of delivering person-centered services and supports that meet each resident's specific needs and preferences. In addition to supporting residents in completing activities of daily living, such as bathing, dressing, managing their medication, assisted living provides a variety of specialized services, including social work, mental health or counseling, or therapies. Additionally, 1 in 5 assisted living providers have a unit, wing or floor designated for the dementia care, or only service adults with dementia. Our department notes Section 3, added funding support for assisted living facilities, page 20, and Section 4M. Specific to Section 3, funding support for assisted living, the National Center for Assisted Living State Regulatory Review of 2024 edition states, the majority of assisted living residents pay privately for room, board, and services. Medicare does not cover services offered by assisted living. While Medicaid does not cover room and board, it may cover personal care services for eligible residents in states that allow a Medicaid waiver in assisted living. The Medicaid program is important for ensuring that seniors and individuals with disabilities are able to receive care in the most appropriate setting. An estimated 48% of communities are Medicaid certified to be home and community-based services providers, while almost 18% of residents rely on Medicaid to cover daily care in assisted living. Under the Division of Public Welfare, Medicaid optional services for long-term care under federal law and regulations, state and territorial Medicaid programs may cover nursing home services for individuals who meet applicable criteria. Some Medicaid programs also cover home and community-based services for people who would need to be in a nursing home if they do not receive the home care services. In most states, but not including Guam, Medicaid programs also cover services that will help individuals who require long-term care services to remain in their homes, such as personal care services, case management, help with laundry and cleaning. However, Medicaid programs do not pay for rent, mortgage, utilities, or food. Guam Medicaid provides medically necessary home health services, which tends to have higher utilization among individuals who require assisted living services, but does not currently cover home and community-based services, personal care services, or case management. Locally, St. Dominic's Senior Care Home is covered by locally funded MIP, the MIP program. Since this facility is not a CMS-certified intermediate care facility, Guam Medicaid is not able to cover intermediate care facility services. Currently, MIP provides supplemental coverage to 37 beneficiaries residing at St. Dominic's Senior Care Home at $251.55 a day, or $91,000 and change per year, which has a total annual cost to the MIP program funded by this legislature at $3.397 million. It should be noted that the Guam Medicaid Office is able to update the Guam Medicaid State Plan or pursue a waiver to provide a range of services to individuals residing in an assisted living facility. In making such updates to the Guam Medicaid State Plan, the financial impact may exceed the current Medicaid cap appropriated and awarded to Guam. The ongoing advocacy to remove the Medicaid cap for territories must continue more aggressively than ever, making it equitable to states who do not share the same limitations. Comments from the Division of General Administration or the Health Professional Licensing Office. The HPLO identifies one concern regarding Bill 3138 in its current form. The bill proposes shifting the responsibility for managing facility from a nursing home administrator to an assisted living facility administrator. This shift would require that the Guam Board of Allied Health Examiners to amend its current rules and regulations. We recommend collaborating with the Allied Health Board to ensure that the bill's provisions will accurately reflect and clearly define the requirements of the administrator. Specifically, NHAs manage facilities providing 24/7 medical care for residents with complex health needs, while assisted living facility administrators oversee facilities for largely independent residents who require varying levels of assistance. Tailoring regulations or requirements specific to the type of administrator will ensure that administrators are qualified and properly trained for their respective roles as it relates to the national standards. The Division of Environmental Health underscores the importance for proper regulations of assisted living facilities in order to avoid health risks to its residents and the community at large, including waste management, cleaning protocols, infrastructure, adequate fall prevention measures, and food handling to prevent injuries and the spread of infectious disease in the community. By setting and enforcing clear environmental health standards, the regulation of assisted living facilities ensures that these facilities maintain safe and sanitary conditions for the target population. In addition, facilities inspections and compliance records can assist families in making informed decisions regarding the care of our manumko and the other suitable residents of the assisted living facility. Please be informed that there is another statute governing the operation of nursing home. Thus, DPHSS would like to recommend the following to be consistent with Bill 3138. Amend subsection 25101F of Title 10 GCA, Chapter 25 to read, Assisted living facilities means a resident for the elderly or the infirm who require assistance with some of the routine activities of daily living, as well as ready access to medical care as needed, and shall include but not limited to the following: an institution, private home, other place, or part of a unit, therefore, however named, whether for profit or not, including facilities operated by the government of Guam, which is advertised, offered, maintained, or operated for the express or implicit purpose of providing accommodation, nursing, or related health care for 2 or more individuals not related to the owner or administrator by blood or marriage within the third degree, between the third degree, which accommodations and care for a period of 24 hours or more, consecutive hours, but shall not include any place providing care and treatment primarily for the acutely of ill. In other words, our hospital. Resident facility for the elderly means a housing arrangement chosen voluntarily by a person 60 years of age or over, or other authorized representative, where varying levels of intensities of care and supervision, protection, supervision, personal care, or health-related services are provided upon their varying needs as determined in order to be admitted and to remain in the facility. People under 60 years of age with compatible needs may be allowed to be admitted or retained in a residential care facility for the elderly if needed. Ensuring that the assisted living facilities provide a safe, healthy, and dignified environment for our Manumco should be a priority. In closing, DPHSS acknowledges the critical gap in services for our elderly population. As family dynamics and economic realities continue to evolve, many families face increasing challenges in providing in-home care for their aging loved ones. This shift underscores the urgent need for alternative care options, such as assisted living facilities, to ensure our elderly receive the quality support, dignity, and specialized care they deserve. We look forward to the passage of Bill 3138 with DPHSS's recommendations included. Thank you for your time and consideration. Thank you, committee.
Thank you, Mrs. Arreola. We've also received written testimony from Jessica Uggins Cepeda in support of Bill 31, as well as written testimony from the Guam Housing and Urban Renewal Authority from Deputy Director Fernando Esteves, who asked me, or his testimony into the record. Hafide, we support the intent, but are in opposition of Bill 3138 as currently written. Bill 31 merely renames nursing home to assisted living facility and creates a hybrid definition that also neglects persons with disabilities who face the same needs as the elderly. I've previously testified on the importance of consistency with the types of residential care facilities. In the recent summit, the Federal Housing Administration of the U.S. Housing Urban Development, HUD, shared resources for the development of residential care facilities. I support updating our statutes to accommodate the development of residential care facilities, but I disagree with the definition that is too far removed from industry standards. The type of facility and how it's defined is critical to informing on services provided, subsequent development, and regulations to its permitting and operations. Additionally, definitions consistent with standard definitions inform potential grantors, regulators, and investors on services provided. There are 5 types of housing facilities for the elderly and persons with disabilities, all except independent living facilities are considered residential care facilities. Examples of each type of facility home is provided for you below. Please take note of the important differences between the various types of facilities. Independent living facility housing are housing units designed for the elderly or non-elderly persons with disabilities. They are designed for ease of use and may include ADA accommodations. Residents are able to live independently without service requirements for daily living or medical care. Example, Gura Elderly Housing, Guma Tranquilidad, Telefofo, Agate, etc. Assisted living facilities are designed to accommodate frail, elderly, and people with disabilities who can live independently but need assistance with activities of daily living. Assistance with eating, bathing, grooming, dressing, and home management activities. ALFs must provide support services such as personal care, transportation, meals, housekeeping, and laundry. They don't require 24-hour assistance or services. Service-enriched housing nursing home is housing that is designed to accommodate frail elderly persons, persons with severe disabilities with service needs. Residents are able to live independently but need assistance with activities of daily living comparable to services provided in assisted living facilities and additionally include healthcare-related services. These supportive services must be available through a licensed or certified third-party service provider. They are typically 24-hour facilities. Example, St. Dominic's. Skilled nursing facilities are long-term inpatient medical facilities that provide transitional care for its patients. Example, GMH Skilled Nursing Facility. Palliative hospice care facility are medical facilities meant to provide physical comfort and emotional, social, and spiritual support for people near the end of their life. Assisted living facilities, service-enriched housing, nursing homes, and skilled nursing facilities are defined as residential care facilities and should be allowable for government or private entities. I highly recommend defining each facility accordingly to clearly delineate the required services by type. There are companies that utilize the age-in-place model. However, the service models are still consistent with the levels of assistance care necessary based on phases in aging. This isn't to say a facility can't be both an independent living facility, assisted living facility, and service-enriched housing facility. However, requirements should be based on the type of service that's being provided, whether singularly or in total. Signed, Fernando Esteves, Deputy Director, Guam Housing Urban Renewal Authority. Thank you for your input. Senator Parkinson, you can begin with the questioning, and you have 5 minutes.
At this time, Madam Chair, I just want to listen to what people have to say, so I don't have any questions at this time.
Okay. Senator Terlaje.
Thank you, Madam Chair. I've been a real advocate when it comes to, finding facilities for our aging population, which by 2030, it's estimated that in the U.S. as well as Japan, there will be more senior citizens than there are children. And this is an area in which we have to address now because we're getting to that point, 2030, yeah, not 2030, but 2030. I did introduce, thank you, Mr. Ada, for bringing up the QC for Bill 111-36 that was introduced. There was another bill that was introduced in the 36th Guam legislature that actually verbatim is exactly what this bill is. It was introduced by then Speaker Terlaje, as well as myself, as well as Senator Therese. I believe she was another co-sponsor of the, literally this bill is exactly word for word except the intent. I'm not sure if we had I don't think there was a public hearing on it, but I do understand the concerns of Gura and having to address some of their concerns, ensuring that the definition is actually spot on, that we're not going to jeopardize one bill that passed earlier compared to a new bill that was introduced by Speaker, now it's Senator Parkinson took the bill and reintroduced her bill, that we don't leave out any other types of facilities, whether it's multi-facility, whether it's independent living, our skilled nursing facility, and that's the most important thing. But I will look at talking with former Senator Esteves, to go over this particular bill and find out his concerns and try and tweak it to bring it to something that it's more conducive to him. But appreciate the testimony from Public Health. Though there was nothing really in that testimony that would, let me pull that one up again. There it is, okay. Yeah, the definitions are very important, Director Arreola. And I don't know if you had the opportunity, did you have an opportunity to read Gura's testimony? I'm sorry, can you turn on the mic? I can't hear you.
No, as the Senator Salas just read it now. I didn't.
Oh, okay.
I'm just hearing it with you.
Okay, so maybe take a copy of that testimony. I think they might have a copy of it with you, and then maybe get a hold of Director Esteves and find out what the concerns are, because of course this has a lot to do with public health and ensuring that those are met. But yeah, it's very contradictory when we have the agencies, going against each other and not being able to work together on something like this. But other than that, like I said, this was an exact same bill that was introduced in the 36. It didn't have a public hearing. It's here today, and at least I'm glad it's being heard right away. So other than that, thank you, Madam Chair. I believe my time is up.
Matt? I believe you had a few more minutes, but Mrs.
Madam
Arreola?
Chair, if I could address Senator Tello's comment about contradiction. There's no contradiction.
I didn't ask a question, Madam Chair. Thank you.
There's no contradiction. I don't see a contradiction. Deputy Fernando Esteves, he mentioned he's in favor of the intent. He was just concerned about of the definition. So I don't.
Director Arreola, he was opposed to the bill. He was opposed to the bill.
It states that we support the intent but are in opposition of Bill 31 as currently written.
Because of the definition. Yeah.
I can provide you a copy
Thank you.
after the hearing. Thank you.
Thank you.
Senator Gumatato?
Thank you, Madam Chair, and thank you, panel, for being and enduring today. I appreciate you both for spending the time, and your team, Director Arreola, for being here today. I don't have very many questions, but I just, in my initial read, there is going to be a statute that would be impacted by Bill 31-38, and that's 10 GCA Chapter 7, nursing homes, which was codified in January of 1975 by Public Law 12-204. Now, in Public Law 2012-204, it referenced compliance to standards, rules, and regulations issued pursuant to the law. So, for the record, what standards, rules, and/or regulations relative to the licensure, operations, and oversight of nursing homes or similar group accommodation facilities have been established pursuant to the Administrative Adjudication Act, or Guam law, since the enactment of Public Law 12-204 nearly 50 years ago? Yeah.
I'll get back to you, because that was what year?
Yeah, it's 12-204.
I will have to look into that
and back to the committee. Yeah, I think it would be important for us as we're going through this.
Or maybe Tom, if I can invite Tom Nadeau to join me. He's the division chief for environmental health, and maybe he knows it because he's been around.
Thank you. Good afternoon. My name is Tom Nadeau. I'm the Chief Environmental Public Health Officer.
Thanks, Tom.
Thank you very much. I can answer in terms of the standards for sanitation. So that there are standards. Chapter 6 of Title 10, Article 3 specifically, they've adopted interim regulations governing nursing homes. But as to your original question, as to licensing, that is not my divisions area, if you will, so I can't answer that. But there are standards for sanitation, which we do apply. But as to the actual licensing of the facility, that is not within our purview.
All right, thank you so much, Tom. Also, in the bill's preamble, it cites Public Law 36111, which was enacted in October of 2022, which authorized a special qualifying certificate program for developers who engage in constructing or substantially renovating existing facilities in order to accommodate the housing needs of our Manamco. Public Law 36111 includes the term residential living, which is defined as a housing arrangement between ADA compliance and the Fair Housing Act for elderly that is chosen voluntarily by persons 55 years of age and over, or their authorized representative, where independent living accommodations, assisted care accommodations, and or nursing home accommodations, or any combination thereof, involving varying levels and intensities of care and supervision, protective supervision, or personal care are provided based on their varying needs that are located within the elderly housing facility. So if you can, I'm hoping that maybe you can help answer what efforts, if any, may have been made to date to provide any maybe awareness of Public Law 36-111, and has the Department of Public Health and Social Services made any effort to address maybe any policy gaps that may exist which could prevent or make it challenging for investors to develop assisted living facilities as defined in Bill 31-38 through the special qualifying certificate program that's authorized by Public Law 36111?
I am not aware of any effort. I think what I heard is any effort that would limit any possible business venture to open. Is that what you're saying?
Yes.
I'm not aware of it. I mean, we said, you know, our limitations are really specific to sanitations and standards of that nature. With regards to any QC promotion that it's available, I wouldn't. I think that would be more of a Geda question. I'm not sure. Maybe I can't say. I'm sure there's a bunch of QCs that they promote on their website. That's my assumption. But that wouldn't be in the public health realm. The public health realm would be, if anything, the sanitation concerns and regulations.
Thank you, Director Ariella. And again, I just want to thank you all for testifying. I am in support of trying to make sure that this bill can work for all the people of Guam. So thank you very much for being here today. Thank you, Madam Chair.
Thank you.
Thank you, Senator Gumatao. Senator Vince Borja.
Thank you, Madam Chair. I have no questions, but I just want to share that, you know, I mean, I met with Mr. Atta previously before this, not before this public hearing, but a couple weeks ago in regards to this proposal, and I'm in full support. I support the intent, but obviously a lot of work to be done with the bill, and so I look forward to discussing this more in committee. Thank you.
Thanks, Senator Borja. Senator Terlaje.
Madam Chair. Thank you for your testimony. I think everyone on Guam is in support of assisted living, right? And what we need to do to get it done is by, as the Senator said, we did introduce a bill back in 2022. It was, we were assisted with that by Geda, and we did have a public hearing. But at the public hearing, there were inconsistent testimony between agencies again, and very much concerns raised by the public guardian as to whether the bill would in fact make any change as to the coverage at persons who were at St. Dominic's, because that was the only place at the time that any type of arrangement like this. And of course, now we have somebody who's proposing to open one. Do you think, we do have what looks like a conflict in definitions between Gura, public health. I'm not sure. I mean, there are existing rules and regs for nursing homes, right? And this bill proposes to redefine everything as an assisted living facility. Nursing homes are a subset of that. So there are some other changes that might need to be made. But does this bill impact coverage at St. Dominic's?
It wouldn't.
In fact,
They're currently being covered by MIP.
right, so they were only being, because in the past, they had been covered by Medicaid, and then public health changed its policy or made a different determination, and now that coverage ended, and so now it's only MIP.
MIP.
That's correct. You said that they were not currently...
CMS.
Yes. Were there any efforts to help them to become CMS certified?
I'm not sure of the past efforts. You know, they're privately run, so I'm sure that I have to believe that their management kind of looked at perhaps what it requires to be a CMS certified, which sometimes it might be very difficult or a business decision. I'm just assuming.
All right, well, because if I remember correctly, that was one of the issues that Public Health had discussed, that they were going to try to pursue that because St. Dominic's was the only place, because they wanted to move some residents out of GMH. It was all a government-wide solution, was to help them to become CMS certified or whatever, and if that was possible, so that they could be covered.
Well, I can,
and that we
what
were
I can
going
do,
to, in turn, you know, revise definitions and things like that on our site that was possible.
So what I can do is I can reach out to the management of St. Dominic's and ask if that's still something that their management is willing to look into. And if so, and if there's a chance that it's a yes, then we'll definitely do what we can as a government to help them get there.
All right, and so this bill doesn't in any way change our eligibility for Medicaid. So would the facility that Mr. Add is proposing be covered by Medicaid?
No, because currently Medicaid doesn't cover.
Okay.
But that's why I added into my testimony that the Medicaid office can revise or update its state plan now that we have I guess, a viable business that wants to open such a facility. And I think we just need to determine, I guess this bill will determine how the business will be licensed, and then on our end, sanitary permits and things of that nature. But it is not currently covered. Medicaid does not currently cover assisted living facilities. Is it possible? Absolutely, we can look into it. But I caution, and I think I mentioned this in my testimony, that we, in the past year, I know last fiscal year, we almost met the cap of the current things we do cover. And so when we add another coverage, another service such as this, we need to do some financial analysis on how that's going to impact. And if it goes over our cap, because we're capped, right, as a territory, then we need to make some hard decisions of what services are currently covered by Medicaid that will no longer be covered by Medicaid if assisted living facilities are a priority over that service.
May I comment, please, if you don't mind? I am very much aware that in some cases, not all cases, Medicaid patients, they will cover for the caregiver. There have been situations that they have covered for that. So just don't know.
No, I think you're talking about separate auxiliary services that Medicaid covers, but we're talking about Medicaid covering room and board and things of that nature. That is currently not covered. But you're correct, Mr. Atta, there are certain services that are covered by Medicaid, but not the facility itself. In other words, an individual wouldn't be able to charge Medicaid for their cost to live there at this moment.
Right, and so the bill doesn't change that. So what we have in place today, what Medicaid is covering, medically necessary home health services, but does not cover home and community-based services, personal care services, or case management, that's still going to be in place after this bill's passed. But it was also in 2022 that I remember, because the public guardian was very adamant, Marcy Santos at that time, that we should update our state plan or pursue that waiver, because there was also testimony by public health where they gave all the different states and what their, which ones had waivers and different things and how they handled this assisted living. So, yeah, I'm surprised if there has been no effort to do that since 2022, because that was one of the reasons I thought we were putting that off. It's because, yeah, that's the whole point, right? We want to have these and make it a viable business so that they can be sustainable here on Guam.
May I completely forgot to mention, this does not preclude even a veteran to apply for assisted living. The question is, who needs it most? And the doctor, we will have to take that from the doctor. The social workers will group together with the doctor, as well as the intake worker and the nurse to determine. So I just wanted to make sure that I don't leave out the veterans, because if somebody wants to, there's nothing to prevent anyone from applying. The question is, who needs it most?
Are we saying this could be private? Your proposal is that it will be privately funded, right? Will MIP apply?
No, we would need to look into that. I think his nonprofit organization mentioned that they have a grant that might, I'm not sure maybe how much they're going to cover, but maybe subsidize. Maybe the word is the grant will probably subsidize.
Yeah. I think our ultimate goal is to get it so that we've got our ducks in a row.
Let me answer that, please, real quickly. As far as the lodging, for them to see, whoever's going to stay, that's going to be shouldered by the individual who is trying to attempt to move in. What we will cover is the services to which we are going to provide him or her. We're not involved in the determining and the payment of their lodging.
All right. All right. I have no objection to that model. I'm just pointing out that we were trying to go something bigger and better, bigger so that many companies can apply for Medicaid so that we would be more sustainable in this industry, in this service that we are providing. So I would ask public health to please pursue and tell us what the analysis shows you, whether, it's worth it or it's not worth it. And if it's not, then I think we should really put that on the record, because we've been waiting 2 years now to hear that it's not going to be pursued because we're going to exceed our cap. But we're really trying to create this as a venue for our elderly here on Guam. Madam Chair.
Thank you, Senator Terlaje. Senator Calvo?
Thank you, Madam Chair. Thank you for your testimonies, Director Therese Ariola and Mr. Peter Alexisada. I have some remarks and some questions later on. I know that Bill 3138 is well intended, which will expand assisted living options for our Manamco, our community's treasure, providing them with dignity, independence, and the care they need. Too many seniors find themselves caught between independent living and full-time nursing home care with very few alternatives. This bill fills the gap by establishing a clear regulatory framework, attracting investment opportunities, and ensuring affordability through Medicaid and other healthcare programs. This legislation is not just about facilities, it's about people. It's about ensuring that our elders can age with dignity, security, and respect, while easing the burden on families struggling to provide adequate care. It also presents an economic opportunity, creation of jobs, and strengthening local businesses in the healthcare sector. I recognize the intent and potential benefits of this measure, particularly in filling the gap between independent living and nursing home care, giving our seniors more choices and reducing the burden on families who struggle to provide care. Now, all we need to do is to ensure that assisted living facilities are affordable, well-regulated, and financially sustainable. It's critical. We need clear oversight mechanisms to prevent financial exploitation or substandard care, and a well-defined funding plan so that these families or facilities do not become out of reach for our low and middle income seniors. Additionally, we must ensure that our healthcare system is equipped to integrate other support services and resources. Now, going to my question, I will direct my question to Director Therese. Does the DPHSS currently have the staffing, training, and resources necessary to regulate ALF or assisted living facilities effectively? Or will additional funding and personnel be required?
Yes and yes. So, no, we don't have the current personnel. Would be an added regulating, an added facility that we're currently not regulating because there's no current business operating, would require us, it'll be another mandate of ours. So with an additional mandate would require additional staff. My understanding is, what I'm hearing is probably this is the first, if anything, that might be possibly coming up. I'm not quite sure where this facility that Guma Oro is looking into, but I'm sure when they start getting their permits and their business license and things like that, it will trigger us to do what we need to do on the sanitation side. Yes, it eventually will get to me. But we currently don't have the staffing because there's currently no business in place. But we would need.
And as you mentioned, an additional mandate is required.
Yeah.
Next question, how frequently will inspections and compliance checks be conducted? Any idea?
Maybe Tom can come. It's probably going to mirror some other facility inspections that we do.
Thank you for the question, ma'am. So in terms of sanitary permit and the definition of nursing homes, there are two facilities that have sanitary permits under the definition of nursing home, and they are skilled nursing facility and the St. Dominic's. And they are what we deemed a facility that caters to a highly susceptible population. So by policy and practice, 4 times a year, that is the establishment right that we have established for current standards we have established for that type of operations.
I see. 4 times a year. Last question, how will, these are things that are unavoidable, right? Complaints and grievances from residents or their family members. How are these going to be handled, and what enforcement actions will be taken if issues arise?
Well, if it is a sanitation or sanitary issue, then of course public health would be involved. But if it's a complaint of management or day-to-day cleanliness, I would have to believe that the business itself and the management will address that. We would only be able to assist in complaints when it comes to any sanitary or even maybe food spoilage issues, anything connected to our sanitation requirement that we oversee. But anything else other than that, the management of the site, I believe that the owners or the business owners will address
We'll
that.
address that. Mr. Ada, would you like to add to that?
Thank you very much. That is the very reason why I invited Environmental Health and Public Works to come and look at the facility themselves and guide me what I need to do. The first thing that came to my mind is it has to be ADA compliant. That was the first thing. And I have to commend environmental health staff. They were very supportive. They tried their best, but they said, Mr. Ada, I'm sorry, we only have rules for nursing homes, nothing for assisted living. I can't fault them on that. At least they were being honest. And so this is where we come in. Yeah, you know, you talk, Senator Calvo, you talked very briefly, and I want to, because I know that all of you, I heard you get out. Let me tell you of an incident. I'm not going to mention any names, okay? Please.
No.
This happened several decades ago here on Guam. A family had their mother, their elderly mother, and the rest of the children had to go to school. The intention was good, but the act was wrong. They locked the mother in the room. As I said, the intention was good so that she doesn't wander out on the road or go out to the kitchen and turn on the stove. But it is wrong. Morally wrong. But to that family, it was the right thing to do because that was the situation they were facing. So, there's where we come in to assist, to help them. We want to be there, you know, we want to make sure that if they want to go, you know, we say assisted living, hey, if they're able to maneuver around, they want to go down on Wednesday to the Chamorro village and dance, hey, go. Just go. Make sure you come back. You let us know what time so that in case you don't come back by 2 o'clock in the morning, we're going to go looking for you, try to figure out where you went. But at least we know where you know. We want to give you that leverage of liberty and not boil you down and say you can't move. No. You've got to give them some hope that they got to move their body. If you want to clean your room, do it. Clean your refrigerator, cook your own food. Hey, doggone it, do it. We're going to encourage you.
Thank you, Mr. Ada. I don't have any further question. I would like to thank you guys once again. And I just want to say that I am so glad that this is already on the table in discussion because the truth of the matter is we're all going to get there. Thank you so much, Madam Chair.
Thank you, Senator Calvo. Senator Parkinson.
So thank you so much for coming in and giving your testimony and for all the support from my colleagues towards the idea of this bill. I really have a strong personal connection to care for our elderly here. Taking care of my sick and elderly father is what brought me back here. And there's a saying that by the time you're 18, you're going to be spending 90% of the time you're ever going to spend with your family by that age. And so despite the burdens of advanced elder care, I find it as a great privilege and honor that I was able to spend more time with my family than what you would normally have in an average lifetime. One of the things that made me introduce this bill and consider this topic is I watched a play here about a year ago here on Guam, and it was a story of a Chamorro man who was institutionalized in an assisted care facility against his will. It was a comedy. And the whole play, this old man and his gang of friends in the assisted living facility are trying to escape to freedom. And then after the second act, you discover that the grandfather has a granddaughter that's alive and who's come to bail him out of the assisted living facility. He discovers that his daughter had put them there against his will because his daughter was terminally ill, and she needed some way to take care of her father, and so she did it as the last possible option. But now the daughter had come of age and was in a position to help take care of Grandpa and wanted to get him out. And at the end of the play, the old man decided that he was going to stay in the assisted living facility because he had made so many good friends there, and he didn't want to burden his granddaughter with the burden of his care. And, you know, while there were some funny parts of it, I can't help but think of the tragedy of that gentleman's daughter, where she was in a terminal situation, and she didn't know she had any resources to help, and so she did something so extreme. And it makes me think of all the people here on Guam who do not have access to assisted living here on the island and have to make do somewhere else. At the end of our lives, this is the time we are supposed to be spending with our families the most. And it is truly tragic that we have to make do elsewhere for that. Care is very hard. And I have to admit that even my own motivations for this bill are very selfish in that I'm a father. And someday I'm going to be old and going to have some needs of my own. And I want to do as much as I can to make sure that I do not burden her with the care of my advanced age. And so we introduced this bill now. I think actually Senator Terlaje might have been there at the same play that night. And so when I was looking for model legislation to potentially introduce to tackle this issue, I'd seen that she had introduced one already. It was fantastic work. It had had a public hearing, and I reintroduced it word for word because I believed it was solid work. And why try to reinvent the wheel? Why try to change a few words around and try to pass it off as original work? No, the work had already been done. Let's continue on that conversation that they had. So on this bill, I am truly policy neutral. For me, what's important is that we get a product that works at the end of the day. I have no sacred cows in here. I have no policy things that are some things that can't change. Ultimately, the thing that drives me is raw, unbridled efficacy. Does it work? To all my colleagues, I appreciate the Socratic dialogue we've had here. I especially appreciate the work of Senator Tello. You know, thank you so much for being able to look at this bill with critical eyes. Despite, you know, being the original co-author, you're still able to look at it critically, and I always appreciate that. And so, you know, let this be something I say to all my colleagues. I am always watching all of your work. And if it is a good idea, I will not hesitate to incorporate it into some of the best ideas we could come up with. Because I always believe that you could do more with collaboration and that ideas that aren't challenged or aren't really fleshed out grow weak. So I appreciate that we have an extended dialogue with this bill. And I look forward to working with Senator Terlaje, Senator Tello, Senator Shelley, Senator Vince, Senator Guma, and the Legislative Secretary, Senator Sabrina Salas Matanane. And whatever we need to do to these bills, let's do them. Let's do them. Whatever good ideas we have, let's make it work. This is an idea whose time has come here on Guam. And we have a rare moment of consensus and cooperation that we want to do this. So let's do it. So I ask my colleagues to support this bill, to give us your best ideas. To the public, please give us your testimony on any way we can make this bill stronger. Ideas that are not challenged grow weak, so challenge the ideas. I don't care if it's Republican or Democrat. Let the best ideas stand on their own. And with that, Madam Chair, I yield the rest of my time. Thank you.
Thank you, Senator Parkinson, and I absolutely agree that we need to work together to move our island forward. And thank you to the panel, to my colleagues for being here today, and thank you to everyone that came and testified on Bill 13 and Bill 31. For those of you who may not have had a chance to speak today, we will continue to accept written testimony until Friday, February 21st. Testimony should be addressed to the Committee on Health and Veterans Affairs and dropped to the Guam Congress Building, or you can email it to office.senatorbree@guamlegislature.gov. Once again, thank you for being a part of this important conversation. That concludes today's public hearing. It is now 5:27. We are adjourned. Sizu Usmasi.